ay ano po yun, para Guys, good afternoon. Okay, can you hear me, guys? If you can hear me, guys, kindly open your cameras and kindly key in kung nasaan kayong lugar ngayon, what city or what country you are in right now. Okay? All right, so we have somebody from Manila. What about the others? Okay. Ang bagal net. Okay, Singapore, Canada. Okay. Okay. So kung okay po yung ano natin, yung signal natin, kindly open your cameras. Okay? Ayan. So good afternoon, guys. Once again, Uh, before we start our class, okay, let's pray first. Hindi alay muna natin itong klase sa mahal na Panginoon. So, let's all put ourselves in the most holy presence of the Lord. For the Catholics, in the name of the Father, of the Son, and of the Holy Ghost. Amen. Lord, as we come into your holy presence, thank you very much sa pagbigay sa amin ng opportunity na makapag-gather uli, makapag-aral, at ma-review itong lahat ng ile-lecture namin. Okay, ile-lecture ko. Okay, so please bless our families, our loved ones. Okay, kayo na pong bahala sa amin. Please bless my students as they embark their journey towards getting that USRN. I pray that you will bless them, enlighten them with the gift of wisdom and knowledge and confidence. Okay, and of course, bless them that they'll be able to pass their NCLEX, hopefully before this year ends. Okay? All this we ask in the most holy name of your Son, ang aming Panginoon na si Jesucristo. Amen and amen. In the Father, and the Son, and the Holy Ghost. Amen and amen. Guys, okay, good evening and good morning, Saudi Arabia. So Saudi, I think, is 4 hours or 5 hours delay. So, good afternoon. Good afternoon din ata, dyan. Okay, so Israel, I think 5 hours din. Okay, SG, okay, yan. Okay, California. Okay. So let me introduce myself, our lecturer for today. I see familiar faces here. I think nag-lecture na ako dito dati, if I'm not mistaken. Pedia? Yes? I think. Okay. So kamusta kayo? Ba't pa kayo nandito? Okay. I thought nakukuha na kayo. Okay, parang nasobrahan ating review natin na. Okay. So meron ba dito kukuha na ng NCLEX? Kung meron na dito na ngayong buwan o di kaya next month, okay, magiging USRN na, okay, please key in the word yes. Kung meron dito. Okay. Ayan, yes. December. Okay, good luck, Mia. Okay. So, ayan. Meron dito. Okay. So, let's review this. December. All right. So, before this year ends, magiging fellow ESRs na tayo, di po ba? Awa ng Diyos, ano? Okay? So tuloy tayo. So, okay, good luck po. Okay, so our topic for today will be oncology nursing. I will be your professor for tonight. Okay, for 4 hours, we'll be starting our class Philippine Standard Time, 5 p.m. It's actually 5:05. We'll be ending our class by 9 p.m. So hopefully we'll maximize our time. Okay? So oncology nursing or cancer nursing. So before we just resume this, okay? Kasi medyo mabilisan yung oras natin. Okay, we're gonna anyway, review to eh. Okay, you all know this. We'll just review this. We'll just recall this. Okay, so let's recall this first by answering a 5 or 10 items na question. I'll give you 5 minutes. Do not put your answers. Okay, do not put your answers on the chat box, but rather we will answer this together later. Okay, so I prepared a matching type here na question. Okay, I say again, do not put your answers on the chat box, but rather get a piece of paper or in your. Okay. And input na po natin to. Okay? And yan. Tuloy po tayo. You have 5 minutes. In my clock, it's 5:06. We'll start our answering by 5:11. Thank you very much. Please answer. Okay, guys, time's up. Guys, kindly check your audios. Okay, kindly mute lang po para hindi po maano yung klase natin. Okay, number 1. What's the medical term for decreased WBC? Guys? All right, what's the answer here? Please key in your answer. Letter. Okay. All right. Letter F, leukopenia. Okay, so leukopenia decreased WBC. Tama ba? Okay, so if a patient is leukopenic or neutropenic WBC, the patient will be at risk for what? Anemia, okay, bleeding or infection. Please answer. The patient will be prone to infection. Tama ba? Yes, basically, all right, not only in cancers. There are some cancers that typically can cause leukopenia. Okay, you have your leukemia itself, of course, since we're talking about blood cancer. Okay, this will make the patient immunosuppressed. You have your multiple myeloma. Tama ba? Also, the management for some particular cancers or cancers per se, like your radiation therapy, particularly chemotherapy, can this actually cause, okay, leukopenia or decreased WBC? Exactly. Nakukuha mo ba? Yes. Now, before we go with number 2, let's first answer number 3. What do you call the medical term of a tumor? Because tumor is a layman's term. What is the medical term for a tumor? Okay? We call this as your what? Your neoplasm. Okay? You call this as your neoplasm. Letter H. Now, tumors or neoplasms can be categorized into 2. Okay? You have your benign and malignant. Tama ba? Benign and malignant. Alam po natin pag sinabing benign, it's also growing. Okay? But benign is less delikado as compared to malignant, which is actually cancerous. So mamaya we're going to talk about this, the 2 types of your tumor. Okay? And some managements. Okay? So we'll just review everything here. Okay? So going back, it's letter H. It's neoplasm. Now, let's go to number 2. This is a tumor growth that the keyword here is not invasive. Okay, not invasive, guys. Okay, excellent, JR. Okay, Melanie. Okay, it's called as benign. Okay, benign tumor. Okay, so examples of which you have your BPH, tama ba? Benign prostatic hyperplasia. What else? Fibrocystic breast, tama ba? Okay, all right. So not invasive, this is actually a tumor or a neoplasm called as benign. Okay, now next, number 4. Chemo drugs that are known to be irritating because most, if not all, chemo drugs are basically acidic. This can cause irritation in the skin, in the GIT lining. Okay? Ang tawag po dito ay vesicant. Tama ba? Yes. Lahat ba nakatama dito? Yes? Okay, vesicants. Tama? Okay. Number 5. Everybody should get this. Hindi pwede magkamali dito ha. Okay. So, number 5. What do you call, okay, loss of hair? All right, excellent. It's alopecia. Okay, alopecia. Now, alopecia could be a manifestation, okay, or could let's just say a side effect of what management for cancer, particularly, okay, radiation therapy, or is it chemotherapy? Saan mas common itong loss of hair na to? Okay, of course, in your chemotherapy. Tama? Because in your chemotherapy, it doesn't only kill your cancer cells, but also normal cells, particularly rapidly dividing cells. And your hair follicles are actually what? Hair follicles are rapidly dividing. Okay? Which reminds me though. Okay, tama di ba? Pag nagpagupit ka, after a couple of weeks, a couple of months, it will grow. Tama ba? Yes. Which reminds me though. When I say alopecia, tama yung sinabi niyo, ni Melanie, ni Noella, okay? That this is actually because of chemotherapy. Because hindi lang po cancer cells but also the normal cells, rapidly dividing cells are affected. Which reminds me though, question, okay? Alopecia, temporary or permanent? Tingin nyo. Temporary or permanent? Tingin nyo. It's only temporary because like we said a while ago, okay, hair follicles are actually rapidly dividing. Okay? So alopecia is only temporary, but of course as nurses, we don't reassure our patients here because yes, it's only temporary, pero if the hair will regrow, it will be a different story. Dati pwede siyang long black hair, shiny hair. Pwede bang mag-iba yung color, yung texture, yung consistency? Pwede po ba? Yes. Are we clear? Okay, so of course, alopecia is actually an issue. Mataas po yung rates ng suicide because of this one. So as nurses, do you need to help your patient? You have nursing issue here, nursing diagnosis, which is what? Okay, body image disturbance. So do you need to address this? Of course. Okay, as nurses, can we educate the parent, the patients, okay, to wear something to cover the baldness, like, you know, like your wigs, your turbans, tama ba? Baseball caps, okay, a wide brim hat, pwede po ba? Yes. Okay, next. Number 6. These are factors or agents that appear to cause cancer. What do you call this? Excellent, carcinogens. Now, nurses, the exact cause of cancer is basically unknown. It is unknown. But there are some risk factors, including carcinogens, na once exposed ang isang tao, ay nagpapataas po ba ng tsansa na magkaroon ng cancer? Yes or no? Yes. Okay? So later, we're gonna review this. Okay? Now next, what do you call the medical term for a decreased platelet count? Decreased platelet count. Okay, what is the answer here? Okay, excellent. It's called what? Thrombocytopenia. Can we expect this? Okay, particularly in a patient with undergoing chemotherapy? Yes, we can actually expect this because like we said, okay, hindi lang po hair follicles ang apektado dito. Can chemotherapy also affect the bone marrow? Yes or no? Yes, your bone marrow, particularly the red bone marrow, okay, is responsible for making your blood cells. Tama ba? Is responsible for making your blood cells, particularly your RBCs, your WBCs, and your platelets. Tama po ba? Yes? Kung apektado ang bone marrow na gumagawa ng blood cells, okay, ang tawag po dito ay myelosuppression. Okay, myelosuppression. Tama ba? Naalala nito? Yes. Myelosuppression, myelo means what? Bone marrow. Pag na-suppress itong activity ng bone marrow, okay, yung produkto niya, yung blood cells, tataas or bababa? Tataas or bababa? Bababa ito. Okay? Now, myelosuppression is the process. What do you call the effect? What do you call the effect? It's pancytopenia. Naalala niyo ito? Yes? Okay. Dito, lahat ay di-decrease. Tama ba? Yes. So decreased RBC can lead to anemia. Decreased WBC, the patient will be immunosuppressed. If the patient is immunosuppressed, is this patient prone to infection? Yes. If the platelets in our question, the platelets is actually low. Here's the question, thrombocytopenia. What would be the effect? Okay, clotting or bleeding? Sagot, clotting or bleeding? It's bleeding. Okay? Actually, to the point of nadir. To the point of nadir. When you say nadir, okay, anong ibig sabihin na nadir, guys? Okay, these are the period wherein the laboratories are way too high or way too low. Way too high or way too low? Sagot? Guys? When you say nadir, anong ibig sabihin? Lowest point. Okay? Laboratory values are its lowest point. Okay? Abnormally low. And when can you expect nadir? In patients with chemotherapy. When can you expect this? Around 7 to 15 days. 7 to 15 days after chemotherapy. That's the reason why, sir, sinasabi mo ba sa amin, patients undergoing chemotherapy can actually, experience nadir? Most probably. Okay? Lalo na pag tinamaan ng bone marrow. Pag tinamaan ng bone marrow, myelosuppression, what will happen, guys? Bababa lahat ng blood cells. So, that you call this as your nadir. And kailan nangyayaring nadir, guys? Okay, 7 to 15 days after the start of your chemotherapy. Are we clear? Okay? Are we clear, mga estudyante ko dito na bigla nawala? Okay, so ako marunong din ako sumabay ng trip nyo. So sige, eto tayo. Ayan. Nakukuha ko ba yung lecture ko? Yes, kahit hindi ako nakikita. Yes or no? Yes. O sige. Ito yung lecture natin, ha? Okay. Ayan. Ba't bigla niyo ako nilayasan? Okay. So sige, wala problema sa akin. Okay? O ayan. Kausapin niyo yung simento sa likod ko at saka yung mga tao doon. Okay. Alright. Yan. Bumalik kayo kung nasaan man kayo ngayon. Okay? Walang problema kung nasa duty kayo. Ayan. Ayan. Bumalik. Bumalik yung mga estudyante ko. Papait naman. Okay. Ito yung gagawin natin, ha. Pag lumayas kayo dito, kausapin itong mga taong tuod sa likod ko. Kasama na si Wong at si Daklis. Ay, mga hayop. Daklis, Wong. Ayan. Nandito sa likod. Hindi pa nagalaw. Okay? Ayan. So, SSD, kopya-kopya. Okay. Mia, kopya. Ronald, okay. Romelin, para matuwa yung magulang niya mamaya na makikita nag-aaral kayo. Ayan, sabihin na, hindi ako nagkamali sa paggastos ng pagpapaaral kila Romelin. Ayan. Okay, kila Mia. Okay. Ayan. Kopya-kopya. If you're done, key in the word done. Guys, I'm sorry if mabilis yung pacing ko. I just wanna make sure na mamaya, okay, is it can maximize the time. We can recall some things about oncology nursing. Done? Okay. All right. So review natin. Review natin. Chemotherapy affects what? Many things. GIT, hair follicles. Pwede bang tamaan yung bone marrow? Yes or no? Yes. What do you call the medical term if the bone marrow is suppressed? Sagot? Pancytopenia or myelosuppression? Pancytopenia or myelosuppression? Sagot? Guys, key in the answer. Myelosuppression. Okay, myelosuppression. What would be the effect if the bone marrow myelosuppression occurs? Okay, of course, ang produkto nitong red bone marrow ay bababa. Bababa. Ang tawag po doon ay pancytopenia. When I say pancytopenia, baba lahat. Okay? RBC anemia. WBC immunosuppression, infection, and platelets in our question a while ago, thrombocytopenia. Okay, patient will be prone to clotting or bleeding, bleeding. But here's the question. Actually, guys, eto, no, you'll be encountering such terms when you study your oncology nursing. That's the reason why we have to review this. Eto, baba yung platelets. Now, ano naman yung tawag natin sa counterpart nito pag umakyat naman itong platelets? Okay, 150 ano? What's the normal platelet count again? 150. Okay, papunta ng 450, tama ba? 150 to 450,000, tama? Pero sabihin natin, naging 500, naging 600, 700. Ano naman ang tawag doon sa medical term pag tumaas? Okay, excellent. JR, your thrombocytosis. Thrombocytosis. Pag tumaas tong platelets, guys, okay, thrombocytosis. If we have bleeding as a result of thrombocytopenia, what do you call? Okay, what will happen if there is increased thrombocytosis? Bleeding or clotting? It's more of clotting. It's more of clotting. Tandaan lang natin, yung pinya ay decrease, yung cytosis ay increase. Yung pinya ay tumutubo sa lupa. Okay? Kung saan galing si BJ Wong at si JC Daklis? Sa lupa, sa hukay. Okay? So pinya, lupa. Okay. Sino ang amoy lupa? Si BJ Wong. Sino yung amoy paa? Si Daklis. Nakukuha pa ba? Ayan. So, di ba? Okay? Pag sinabing cancer, okay? Yung mukhang paa si Daklis. Okay? Yung amoy lupa si Wong. Ayan. Okay. Alright. So, cytosis atis, saan nagatubo yung atis, guys? Ang tumutubo yung atis? Sa ibabaw ng kahoy. So, pinya lupa, baba. Cytosis taas, atis. Are we clear? Yes? Okay? Tuloy tayo. Now, next, tumor. What is the medical term for a tumor, guys? Neoplasm. Neoplasm, right? Okay. Now, this is actually invasive, capable of spreading, metastasizing. You call this as your what? Your malignant. So mamaya, guys, we will try to simplify this, the difference of benign and malignant. And what are such therapies or treatments or management, okay, in such specific neoplasms. Okay? Now next, number 9. Prevents the growth, development of or spread of a cancer. What do you call this, guys? Your chemotherapeutic drugs, also known as your anti-neoplastics. Your anti-neoplastics. Now, last but not the least, leakage of IV medication into the tissue surrounding the IV site, guys. Okay, what do you call this? Of course, extravasation. Extravasation. Okay? All right. How's your score, nurses? Please key in your scores there. Okay. 1 to 10. Excellent. Okay. Ruby. Okay. Christine, 1 lang. Michelle. Okay. Refi. Ronald, ilan yung score mo? Ronald. Okay. Excellent, excellent. Ayos. Okay. Teka lang before I proceed. Sir, di po ba pag sinabing chemo drugs, ang pinaka-common na side effect nito, pinaka-common na side effect, sir, di ba? Nabasa ko sa libro to, sir. Di ba, sir, nausea and vomiting? Okay? Ano pa yung extravasation? O, kaklarify natin muna to saglit lang kasi marami ditong medyo nalilito. Okay? Guys, depende po yan. Okay? Nausea and vomiting, tama ito kung ang ruta ay nasa bunganga, oral. Okay? Now, itong extravasation na to, okay, ano yung ruta niya? Oral or IV? It's more of IV. The cause of this one is actually a vesicant. Okay? An IV vesicant. So later, if you have time, we have to review this. Ito yung gagawin ko para ma-maximize yung oras. So okay lang sa inyo. Lecture ako dito. Some of my lectures will not be in the post-test. Okay lang. Bakit? Review at the same time mamaya, as we answer, we lecture as well. Okay lang ba? Ma-maximize yung oras. Kung okay sa inyo. Okay? Now, tuloy tayo. Okay. So eto Okay. Eto nausea and vomiting. Okay? Ako pag oral route. Another question dito. Okay? It's actually a basic question. Alam kong NGN yung exams nyo. Kukunin na NCLEX, no? So hindi traditional, but trust me on this. Know the basics. Okay? Read the question. Get the keywords. Comprehend the question. Okay? Divide and conquer. Find the correct answer. Okay? Now, since nausea and vomiting is inevitable, hindi matatakasan pag oral chemo. Lalo na pag, actually, most if not all chemo are acidic. Okay? Should we expect antiemetics, your domperidone, your Placil, your Dramamine, okay, antiemetics to be given? Yes or no? Yes. Here's the common question. Okay? The time that you give this. Okay? On Dancentron. Okay? On Dancentron. Pasensya na medyo mahina ako sa gamot kasi ang hirap i-memorize. Tama ba? Meron ba dito na paborito kong subject pharma? Okay. Kasama na yung CHN dati. Ayan, meron ba dito? Okay. Wala naman sana, no? Okay. All right. So Fran, ayan. Salamat guys, tulungan niyo ako dito. Dati ako Glaxo. Okay. Thank you sir. KD, tulungan mo ako sa gamot sir ha. Kasi naalala ko lang yan, mga aspirin, ayan, ang easy niyan. Okay? All right. Mga domperidone, Placil, ano pa ngayon? Yung Dramamine, Zofran. Wala mang gamot na Omsim? Mismo. Okay. Akala ko gamot yung Omsim. Munti ka na ako mabudol doon Okay, guys, wag niyong copyin yung Omsim. Mismo pala yun. Okay? Sabi ko, Omsim. Okay? Ayan. Oms. Yun. Okay, no problem. Okay? Now, anyways, going back. We give you antiemetics here. You give you antiemetics. But when is the best time? Since nausea and vomiting is inevitable, excellent Angelica, we give this before the start of your chemotherapy. To be specific, at least 30 minutes to 1 hour. At least 30 minutes, okay, to 1 hour. We give your what? Your antiemetics because basically, nausea and vomiting is inevitable. Okay? Exactly. Para may leeway time pa mag-effect yung drug. Exactly. Okay? Alright. Pero, ibang usapan naman pag IV. Kasi IV, alright, not necessarily we give your chemo drugs, even though there are some books you have to give your chemo drugs. Guys, we're talking about NCLEX here. Okay? Now, sir, saan ba mas common itong nausea and vomiting na to? Oral or IV? Alamin natin. Okay. Pag sinabing oral, okay? Kasi the reason why, okay, for nausea and vomiting, okay, the reason for this, side effect na nausea and vomiting, remember, your chemo drugs, most if not all, are naturally acidic. So pag acidic ito, will this actually affect the mucosal lining of your GIT? Yes or no? The mucosal lining of your GIT? Exactly, tama. Okay, tama yan. Okay? So pag oral, naturalmente, dadaan talaga ng GIT yan. Tama ba? Okay? Pag sinabing IV, saan diretso? Sa GIT or sa system? Sa blood? Sa blood. So between oral route, okay, and IV route, Sino mas common ang nausea and vomiting sa oral? Are we learning? Yes? Dito sa IV, what do we do? Exactly. Depende sa question. Okay, depende sa question. So read the questions carefully. Check what is the route. Okay? Now sa IV, I'm not saying that this is not a possibility. Pwede mangyari yan, nausea and vomiting, but we do not give this because IV site palagi. Okay? IV site palagi and most for the blood return and all. Kasi ganito, diretso na siya ng blood, okay, ng circulation. So the chances of nausea and vomiting are quite small as opposed to an oral route or route. Nakukuha po ba? Nurses? Yes? Okay. So let's move on, no? Okay? Right, exactly. Thank you, thank you, thank you. Okay, so if you're done, key in the word done. Done? Okay, now, let's now talk about some risk factors with regards to cancer. Okay, ang gagawin ko na lang dito, okay, tapon na lang ako ng bullets. Okay, bullets tayo dito. Okay, then remember, you know this, you just forgot siguro, we will recall this. Okay, so copy muna guys. Okay, copy muna. Then isa-isahin natin. Siguro mas okay siguro kung screenshot ano. Pero kung gusto niyo kumopya, okay din. Pero mas okay siguro screenshot para at least during break time mamaya sa hapunan natin, okay, pwede niyong i-transfer sa notebook niyo. Okay? All right. Screenshot. Dude, ayan. Code, ano yung pangalan mo, Code? Pwede lang first name? Kobe. Code, okay. Paring Kobe, ayan. Kita-kits. So, good luck and God bless to each and everyone. This is really exciting because, well, some of you here were my students before sa NLE. Okay, and here you are. You're already RNs. Hopefully, awan ng Diyos, maging US RNs naman. Okay? Hopefully. Okay, so claiming it, di ba? Expected. Okay. Now, guys, the cause for cancer per se is unknown. We all know this. Okay? Even though there are some theories that says otherwise, but then again, they remain theories. Okay, so it's idiopathic. But are there some risk factors that we can actually use to determine if the patient is at risk for cancer? Okay, and are there also some cancers, okay, that we can actually say na medyo magkapareho? Okay, cancer or no cancer, but they share the similar, manifestations. O halimbawa, okay, sabihin natin back pain. Sabihin natin urinary obstruction. Meron ba nun sa BPH? Yes. Meron ba nun sa prostate cancer? Yes. Kasi what do they share? What do they have in common? Okay. Both of the condition in prostate cancer and BPH ay lumalaki yung prostate. So technically, medyo pareho ang manifestations na lalabas. May mga konting difference. And of course, the cause. So, do we need risk factors to not only siguro confirm, no, because biopsy will confirm, do we actually need risk factors to distinguish some conditions or even similar cancers that will share the same manifestation? Yes. Now, review natin. Okay? Anong ibig sabihin ng salitang Cyto? Okay, C2 or Cyto. Okay, yes, to rule out din. Anong ibig sabihin ng C2 or Cyto? Okay? Site of origin. Tama ba? Site of origin. Kung saan nanggaling. Tama ba? Now, nurses, soon to be USRNs. Okay, 2023. Year 2023 USRNs. Are you with me? Yes? Okay. Give me an example, okay, of a cancer wherein the C2 or Cyto can be found in the lymph nodes. Okay, lymph nodes. Ano yung tawag doon? Carcinoma, osteocarcinoma, okay, osteosarcoma, leukemia, or lymphoma? Excellent. It's known as your lymphoma. Okay, it's known as your lymphoma. Now, okay, dito muna. Okay, ilang klase ang lymphoma? How many types of lymphomas are there? Okay, excellent. Alright? Lymphoma guys. COBS, lymphoma, hindi leukemia, lymphoma. Little and malaki. hindi lymphoma, hindi leukemia dude. Okay? Alright, lymphoma. Ilang klase 'yon? Excellent. 3. Yung Burkitt's, yung Hodgkin's, yung isa is Burkitt's. I don't know if my spelling is correct, no? Burkitt's lymphoma. Okay? Your Hodgkin's. Okay? Wag na lang, hindi ako sure sa spelling. Burkitt's, Hodgkin's, and non-Hodgkin's. Okay? Non-Hodgkin's. These are actually lymphoma. Now, we're talking here about age. Now, can we use age to distinguish which is which? Yes or no? Yes, aside from the cause, aside from the area of the immune system or the lymph nodes involved, can we actually use age to distinguish these two types of cancer? Yes or no? Yes. Now, okay, alin dito, parang lymphoma to, Hodge and non-Hodge, parang lymphoma, pero alin dito ang para sa young adults? Young adults and the younger generation. Hodge or non-Hodge? Hodge or non-Hodge? Okay, it's Hodgkin's. Okay? Hodgkin's at what age? 20 to 40 years of age. Okay, in some books is 15. Okay? Let's use 20 to 40 years of age. Now, alin naman dito yung lymphoma sa matanda? Okay? You have your what? You have your non-Hodgkin's, 55 years old pataas. Okay? Parang lymphoma to. But then again, can age actually distinguish who's who? Yes or no? Yes. All right? Okay. Now, since we're talking about lymphoma, okay, Hodgkin's and non-Hodgkin's, okay, let's talk a little about this one. Okay lang po ba? Let's try to distinguish Hodge from non-Hodge. Okay lang? Okay? So let's talk about Hodge versus non-Hodge. Okay? Now, okay, first things first, parehong lymphoma. Okay? Parehong lymphoma. Okay? Yes. But then again, anong distinguishing factor guys? Ito for the young adults. Okay? Ito naman, older population. Excellent, Kobe. Okay? So dito, alright. Ang isang distinguishing factor pa, ang tinatawag na Reed-Sternberg giant cells. Sino dito ang positive sa tinatawag na Reed-Sternberg giant cells? Upon biopsy, you would see in the lymph nodes the presence of this Reed-Sternberg giant cells. Okay, it's your what? Your Hodgkin's. Tama? Isang distinguishing factor. Next, sino naman si non-Hodgkin's? Meron ba siya or wala? Dito, negative siya sa Reed-Sternberg giant cells. Okay? Now, next question, mga USRNs. Sinong delikado dito? I mean, pareho ha. Parehong delikado, pero sino mas mabilis na mamatay dito? Hodge or non-Hodge? Okay? Alamin natin, in terms of pattern. Okay? In terms of pattern. Sino ang may pattern dito? Hodge or non-Hodge? Hodge or non-Hodge? Okay. Yung may pattern ay Hodgkin's. Sinong walang pattern? Non-Hodgkin's. Dito pa lang nurses. Okay. Sa Hodge and non-Hodge. Sa pattern. Sino mas delikado? May pattern or walang pattern? Obviously, yung walang pattern. Okay? Pag walang pattern, saan ka mag-umpisa? Tama ba? Paano mo ayusin? Tama ba? Mas delikado siya. So dito, in terms of prognosis, this actually has bad prognosis. Kasi wala siyang pattern. Okay? Exactly. Patients with STDs, okay, HIVs, okay, ito yung ending niyan, non-Hodgkin's. Tama? Okay, because the immune system is way too low to the point of nadir. The T cells here, okay, the T lymphocytes are actually in nadir, less than 200. Galing, ayos, okay. Now, in terms naman of prognosis, yes, almost depleted. In terms naman of prognosis, yung Hodgkin's has pretty much a good chance of, mas mahaba yung lifespan dito. Okay? Alright? And manageable. Of course, if detected early and managed early. One good example would be okay, the guitarista of parokya, okay, awa ng Diyos, 'di ba, is already on remission. Okay? Si Gabs, tama ba? Okay, awa ng Diyos naka lampas. Okay, yan. Si Boost Nurse nun. Okay. All right. Estudyante ko pala. Okay. Now, done? Okay. So, pwede age, no? Di ba? Pwede ba age? Yes. Okay. Next. Okay. Balik tayo dito. Give me an example, okay, of a cancer wherein the cyto can be found, okay, in the blood. Anong tawag doon? Okay. Carcinoma, osteosarcoma, lymphoma, or leukemia. You call this as your what? Your leukemia. Now, when you say leukemia, ilang klase ang leukemia? Ilang klaseng leukemia? Okay, how many types of leukemias are there? Excellent. Okay. Alright. Actually, 4 po yun. Pero sa nag-answer ng 2, tama po yun. Sir, bakit naging 4? 2 acute, 2 chronic. Nakukuha ba? 2 acute, 2 chronic. Let's try to use acute. You have your ALL and your AML. Okay? Pero dapat, actually tama yung 2, pero technically 4 po siya kasi 2 acute, 2 chronic. Okay? Tandaan lang natin guys, okay, that generally speaking, tama yung sinabi nyo, okay, little at malaki. L stands for lymphocytic, lymphoid, or lymphoblastic. Let's try to use the word lymphocytic. Okay? Now, AML, M stands for myelogenous. Okay? Myelogenous. Okay. Cobs, little, and malaki. Hindi malaki. Right? Okay, myeloid cells and target. Actually, all the WBCs, even the blast cells, your basophils, neutrophils, eosinophils, okay, leukophils. Tama? Sino dito? Okay, so sir, age actually plays a factor here. Now, age. Sino dito? Common ang pangbata, no, pangbata. Okay, 19 years old and below. ALL, lymphocytic, or myelogenous? Less than 19 or 20 years old. Tandaan lang, okay? L stands for lymphocytic, L stands for little. Ayan, okay. Mary had a little lamb. Okay, ayan. So pangbata itong ALL. So basically, this is common, no? Okay, for adolescent, for teenagers, school age. Okay, dito, it's less than 20 years old and below. Okay? Alright. Itong myelogenous naman, common ito sa ages 30 years old, 35 years old, and above. Tandaan lang, L is for little, pambata, M is for matanda. Katulad ni Wong at ni Daklis. Okay. Yung isa galing sa hukay, yung isa amoy ukay. Okay? Amoy hukay. Ayan. So, tandaan lang, little, okay, at matanda. Okay? Nakukuha ba? Yes. So, parehong leukemia. Parehong leukemia, pero isa yung pangbata, isa pang matanda. Nakukuha. Which reminds me though, okay? We are reviewing here. Sino mas delikado? Okay? Sino yung good prognosis? Sino yung bad prognosis? Okay. Unahin muna natin yung bad prognosis. Lympho or myelogenous? Bad prognosis. Bad prognosis. Usually, if you are diagnosed with this type of leukemia, you have 6 months to 1 year to live. Okay, based on the books. Excellent. Bad is myelogenous, bad prognosis. Okay? While your lymphocytic actually has good prognosis. Why? In your lymphocytic, guys, meron tayong tinatawag na, okay, relapse and remission. Relapse and remission. Wait lang guys ha. Hindi ka makataga. Okay. Okay, merong relapse at merong remission. Now, pag sinabing relapse, bumabalik yung manifestations. Pag sinabing remission, nawawala. Tama ba? As long as the patient is on remission, okay, nawawala, wala problema. Okay? So your goal here is to give something, no? A chemo drug, okay? Your chemo drug here to make sure that the relapse actually is doesn't occur. Okay, you need to make sure the immune system is well maintained on a healthy level. Okay, and you prevent attacks or of relapse. Make sure the patient is on remission. Okay, all right. So that's another reference to age. That's important. That's how important age is in determining cancer. Okay, all right. Are you done? If you're done, key in the word done. Okay? Okay lang ba yung pacing natin? Any additional inputs? Okay lang? Alright. Alright, tuloy tayo. Okay. Now, next. Alright. Age. What's the relevance of age here? Okay, example guys. Okay, example, we have your what? We have your breast cancer. Even prostate cancer. Okay, now, at what age usually mataas yung cases nitong dalawang cancer na to? Okay? 40 years old. Tama ba? 40 years old at pataas. Okay? Tama? Okay. So age itself plays a major role here as well. Okay, the start of exactly, actually hindi lang menopause eh. Okay? The hormone estrogen here is actually involved. So not only menopause but basically early menarche. Tama ba? Yes. Next, also your testicular cancer. Okay? Testicular cancer is least common as opposed to prostate. Pero at what age usually? Okay, mataas yung chance ng testicular cancer. Okay? Lalo na if you try to adhere a congenital condition known as your undescended testes. Yung tawag doon, your cryptorchidism. Okay? Hormones plus cryptorchidism, tumataas ba yung tsansa ng testicular cancer? Yes, at the age 15 to 35 years old. 15 to 35 years old. So going back here, age itself actually plays a huge role. Okay, in this type of in this cancer, tama ba? It's actually plays a huge role. Okay? So please copy if you're done, key in the word done. Okay? All right. By the way, okay, just for the benefit of those na nakalimutan to, what is cryptorchidism, guys? The smallest description of the problem here is undescended testicles. Undescended. Okay? Undescended testicles or testes. Okay? Undescended testes. Ayan. So, lalong tumataas yung tsansa ng testicular cancer. Okay? Aside from hormonal imbalance, hormonal cause, okay? If the child has cryptorchidism, tumataas pa yung tsansa. Okay? Exactly. Now, even though naayos to through surgery, mataas pa rin po ba yung tsansa na pwede magka-testicular cancer? Yes. Okay? Now, let's go back here. Gender. Okay? Gender. Does gender play a role in some of your cancers? Let's find out. Okay, let's find out. Pag sinabing breast cancer, okay, sino ang tinatamaan ng breast cancer, guys? Lalaki or babae? Sagot? Lalaki or babae? Excellent. The answer here is both. But 99% goes to the women. Okay? And 1% goes to the men. Now, sino dito ang maswerteng 1% na lalaki na magka-breast cancer? Mataas yung tsansa. Okay? Those who are taking the pills. Okay, sa mga kapatid po natin, no, with all due respect, no? Okay. Grabe ka man, Kob. Okay. Malas yung tawag. Okay. Alright, hindi po. Okay, so sa mga kapatid po natin na sa LGBTQ community, with all due respect, those who are taking pills, okay, those who have big breast, okay, those who have, gynecomastia, okay, those who are obese. Tama ba? Okay? Alright. But, what am I saying here? Okay, hindi lang po babae, but 1% is 1%. Let's call a spade a spade. There's still a chance na pwede magka-breast cancer ang lalaki. Tama ba? Yes. But let's use women. Okay? So this is actually more common in women, okay, in girls. Okay? Age 40 and above in women. Okay? In women or the females. Now, hormones plays a role in some of your cancer. That's the reason why. Are there actually reproductive cancers? Yes or no? Yes, meron no? Okay? Now, among the many hormones in women, progesterone, okay, prolactin, okay, what else? Gonadotropin. What hormone is actually responsible? Estrogen. Okay? Now, estrogen. That's the reason why, guys, okay, that's the reason why. Are you familiar? Okay, can you give me that example, this common medication na binibigay sa isang babae, okay, even though after successful breast surgery, after successful RM or MRM, your radical mastectomy, okay? Anong medication ang binibigay dito? Excellent. Kaya ginagamit ng tamoxifen. Okay? Tamoxifen, brand name here is Nolvadex. Iba ito sa raloxifene or Evista. Yun, estrogen yun. Pero itong tamoxifen or Nolvadex, estrogen or anti-estrogen. Okay? Anti-estrogen po ito. Okay? Saan to binibigay? Sa breast cancer. Okay. Now, sir. Okay, kopya mo na. I want to explain some things here. Exactly. Actually, hindi lang ganun eh. Madami. Okay, are you done? Now, since estrogen is the reason why there is breast cancer, okay, should we give an anti-estrogen to balance this? Exactly. All right? So we give an anti-estrogen, okay, to balance. Okay, kasi ganito yan. Lalaki, babae, okay, merong estrogen and testosterone. We all know this. But since lalaki ako, okay, kami ni Sir Ronald, ni Sir Kobe, we also have estrogen, pero medyo may konting killing yung testosterone namin. Okay? That explains the voice, the facial hair, and all. Same goes with Ma'am Mia. Ma'am Mia is a woman, so basically, aside from estrogen, she has testosterone, pero medyo mas mataas yung estrogen nila. Okay? Nakukuha po ba? Yes? Now, in the case of breast cancer, ano nangyari? Estrogen, testosterone, this is your breast cancer. Significantly increased yung exposure sa estrogen, kaya binibigyan ng anti-estrogen in the form of tamoxifen, Nolvadex. Pero ang tanong dito, sir, na-mention mo kanina, after a breast surgery, successful surgery for that matter, bakit sir bibigyan pa nito? Okay, sabihin natin unilateral MRM or RM na para lahat ubos. Okay, radical mastectomy. Sir, bakit pang bibigyan nito? Here's the question. Okay, wala ka ng breast, naunang isang breast, but we still have the other breast. Yes, is there a possibility the breast cancer can reoccur? Yes or no? Yes, remember, one of the possible culprits or reason why you have cancer is the hormone estrogen. Okay? And you have lymph nodes connecting your right and left breast. Pwede ba mag-reoccur? Yes. Tama? Okay. So, bibigyan natin. Actually, minimum of 5 years to. Okay? Oral intake, 4 milligrams. Now, why do I a little bit actually know this? Because actually, guys, this hits closer to home. Okay? Kasi 2 years ago, alright, during pandemic, yung pinsan ko sa Manila, nagkaroon po nito. Okay, awa ng Diyos, okay, I learned a little from this. So I was able to educate her. So right now, she's on tamoxifen, Nolvadex. Awa ng Diyos, she's on remission. Hopefully, tuloy-tuloy na. Fingers crossed. So, tamoxifen, Nolvadex is an anti-estrogen. Now, sir, pwede pag isang breast tatanggalin kasi may other breast pa. What if, halimbawa lang po, Angelina Jolie. Okay, bilateral RM yun. Okay, the breast was actually removed, the breast tissue, tama ba? Okay. Pag bilateral breast surgery, removal, mastectomy, okay? Can you still expect this to be given? Tingin nyo. Guys, same students are answering. What about the others, no? You are all 47. Sa isang breast, unilateral, bibigyan natin, meron pang remaining. Pero what if bilateral? Dalawang breast ang tinanggal. Can you expect this, Sir Ronald, Ma'am Romelyn? Okay? Ma'am Mia, dalawang breast tinanggal, bibigyan pa rin. Tingin nyo. Excellent, KD. Okay, Giovanni. Okay? Excellent. Okay, now, here's the question. Bakit? Wala nang breast, di ba? Okay, Nestor, Angelica. Alright, bakit kaya? Tingin mo. Tingin nyo. Okay. Okay, Cobs. Very good. May lymph nodes? Well, not really kasi pag sinabing RM and MRM, radical, okay, actually that involves the lymph nodes. Excellent, Camille. Tama yung sinabi ni Kobe kanina. Okay? Hindi breast ang issue dito. Ang isang trigger ng cancer dito, okay, is the hormones. O, teka lang. Ano bang gumagawa ng estrogen sa babae? Di ba ovaries? Is there a possibility na tanggal natin yung breast? Pwede bang magkaroon ng sequelae? Okay? Pwede bang magkaroon ng panibagong cancer yung babae? Sabihin natin ovarian cancer. Sabihin natin endometrial cancer. Even cervical cancer. Tama ba? Pelvic. Tama? Uterine. What do they have in common? The hormone estrogen. Nakukuha po ba? Tama ba? Yes, kahit tabso, hormone is still hormones. There are still some cases. Tama ba? Alright? Even though it's quite rare. Kaya tama, pwede. Kaya usually, ina-advise ng doktor dito, tinatanong yung babae dito na, do you still plan of getting more children, of bearing more children? Because if not, it's really safer for you, okay, to have them reproductive system removed na lang. Magpatabso na lang. Okay? Pampabawas ng possibility ng for cancer to occur because the organs we mentioned a while ago, what's their common denominator? The hormone estrogen. Tama po ba? Yes. Are we clear? All right. Now, I want to add something here. Okay? Tamoxifen, Valdex. What are the common adverse effects of this medication? Okay, please copy this. Okay, number 1, visual disturbance. Okay. Number 2, okay, you have your anorexia. And number 3, you have your headaches. Among the many, irritability, restlessness is still it's there. But I wanted to remember this because I've encountered this question in a particular reference. Okay? Now, alin dito ang iyong priority? Okay? Visual disturbance, anorexia, and headaches. It's actually visual disturbance. So if visual disturbance is a possibility for a patient taking this one, okay, should you advise your patient to refrain from operating heavy machineries, okay, refrain from driving, and most importantly, should you advise your patient to have periodic or regular eye exams? Yes or no? Yes. Exam question, exam answer. The answers there was advise your patient to have periodic or regular eye exams since visual disturbance is a possibility of patients taking tamoxifen, Nolvadex, an anti-estrogen hormone antagonist. Okay, please copy, guys. Edema, yes, lymphedema, it's more on the surgery later. Pero Cobs, ano yun? Sa mastectomy yun. Mastectomy mamaya. Okay? Ito, tamoxifen, Nolvadex. What are the possible effects of this medication? Okay? Done? Okay, tuloy tayo? Or break na tayo? Wala problema sa akin. Break. Nako, paborito kong subject yan. Break. Isang oras? Okay, hindi, biro lang. Tuloy tayo. Baka maulan ako ng trabaho. Now, next, we have your what? We have your prostate cancer. Okay? Prostate cancer. Okay? Sa prostate cancer, guys. Okay? Now, saan to common? Lalaki, babae, or both? Okay. Seryoso ha? Okay. Saan to common? Siyempre sa lalaki, kailan pa nagka-prostate ang babae, di po ba? Okay? Ayan, yan, pwede. Yan, si Daklis, si Wong, yun. Lalo na si Wong. Okay? Mukhang prostate. Okay? Ni Wong. Ayan. Sa lalaki, na what hormone naman, okay, ang responsible dito sa prostate cancer, even testicular cancer? Your hormone, testosterone. Okay. Your hormone, testosterone. Okay? Now, kabaliktaran ito ng breast cancer, itong prostate cancer. The hormone testosterone naman nandito. Okay? Now, kaya nga po, dito, you can expect patients undergoing prostate cancer to be prescribed by a medication known as your DES. And what is DES, guys? Your DES stands for your diethylstilbestrol. Okay, diethylstilbestrol. Okay? In plain English, is this actually synthetic or man-made estrogen? Yes. Okay? That is to counter-check. Okay? Check and balance, okay, yung estrogen as opposed to the testosterone. Okay? Now, remember that this medication is actually estrogen, synthetic estrogen to. So, what are the usual side effects here, okay, of this medication? What would be the common complaints of a guy na may prostate cancer taking this medication? Excellent. Gynecomastia is one. Okay, what else? Can we also say hot flashes? Pwede? Yes. Can we also say mood swings? Yes. Can we also say sensitive breast and nipples? Yes. Because due to this hormone being estrogen. But yung delikado dito that you need to watch out for are the formation of clots. Okay? Why? What does hormone do? What does estrogen hormone do to your blood? It actually thickens the blood. Okay? Pinapakapal ang dugo ng pasyente. Excellent, Kobe. Okay? So, if this actually thickens the blood, this is actually, the patient will be at risk for DVT, deep vein thrombosis. The patient will be at risk for what? CVA or stroke. So, dito, inform your patient to wear compression stockings, avoid massage sa paa. Increase the fluid intake. Okay? Blood thinners, pwede. Pwede, blood thinners. But then again, you have to remember that thrombocytopenia is also, okay, a possibility of this patient undergoing prostate cancer. Okay? Cancer kasi. So check and balance din. Kasi most probably the patient is on chemotherapy. Bahagi to sa cocktail na chemo drug, pinaghalo, pero hindi binibigay sabay. Hindi binibigay sabay. Okay? And when you say chemotherapy, pancytopenia. Di po ba? Okay, baba yung thrombocytopenia, bleeding. Tama? Yes. That's why every now and then, laboratory values, blood works or serum blood or serum test or blood test are actually extracted here and checked. Okay? All right. CBC, excellent. Okay, done? If you're done, USRNs, please key in the word done so we can resume. Done? Okay na po ito? Alright, tuloy po tayo ha. Okay, next. Okay, geographic location. We all know this. If you're living in a urban area, in a rural area, mas mataas yung chances sa tinatawag na, okay, mas mataas yung chances sa tinatawag na urban area, city area. Okay? But, okay, exactly, dahil sa uso, carcinogens. Pero, does this mean na pag nasa probinsya ka, mas less ba? Hindi ka ba magkaka-cancer pag sa probinsya? Not necessarily, because if you're in the rural area, you're still also exposed to the UV rays. Okay? To the UV rays of the sun. Okay? To the UV rays of the sun that can actually damage the DNA of your skin. Tama ba? Which can lead to what? Melanoma. The most common type, the most deadly type of skin cancer. Tama ba? Yes? Okay. Which reminds me. Okay? Which reminds me. Let's talk a little about this one. Okay. Kasi hindi ko to nabigyan ng emphasis last time. Okay. When you say skin cancer. Okay. When you say skin cancer. Okay. Obviously, this is cancer in the skin. Tama ba? Yes. This actually occurs. Okay. Alright. Due to damage. Okay. Due to damage of the skin cells. Okay. Skin cells DNA. Okay. By overexposure. Okay? By overexposure. Guys, kumopya lang kayo ha. Para at least madami kayong makopya. Matuwa magulang nyo, madadagan yung baon nyo bukas. So, kopya lang. 2 UV rays. Ultraviolet rays. Okay? Sa NCLEX, kasama na dito yung tinatawag na tanning beds. Ayan. Yan. Tanning beds. Ito yung kailangan ni Wong ngayon kasi si Wong, no, sa sobrang puti ni Wong, minsan na pagkakamalang lamang lupa, galing sa hukay, lagyan mo ng barong si Wong at saka ribbon dito. Okay? Pwede na siyang ilibing. Di po ba? Pwede siyang model ng St. Peter. Di po ba? Okay? Lagyan mo ng tali sa liig. Yan. So si Wong, pwede. Okay? Tama. Okay. So tanning beds. Okay? Now, what are some risk factors? Okay, what are some risk factors of your skin cancer? Okay, number 1, of course, genetics play a role. Okay, genetics play a role. We all know this. If skin cancer or cancer per se runs in your family, tama ba, Kobe, Eunice? Okay? All right, I don't need to explain this. Genetics plays a role. If cancer runs in your family, okay, Kobe, Eunice, is there a possibility na pwedeng may pasa ito sa inyo? Ronald, Mia? Exactly. Next. Can we say ethnicity or race? Okay, ethnicity or race. Yes or no? Yes. Common ito syempre sa Caucasians. Okay, Caucasians. But let's go a little a little bit deeper here. Okay. Now, exactly. Common sa Caucasians, mas lesser. Okay, sa African Americans. But let's go deeper in terms of ethnicity. Okay. What common ethnicity are actually prone here? Those who are Celtic, no? Celtic origins. Celtic ancestry. So, Irish. Okay? Celtic ancestry na traits. So, Irish. Tama ba? Yung Americans mapuputi, pero level up itong pagkaputi ng mga Irish. Tama ba? So, sobrang puti, less melanin, less protection. Okay? Alright. Particularly, yung mga Celtics, okay, those who have light skin. Okay, Celtics have actually light skin. What else? Okay, they are what? They have blonde hair. Okay, blonde or red hair. Red hair, yung mga brunettes, tama ba? Red hair. Okay, their eyes, no? In terms of eyes, okay, blue or green eyes. Okay, blue or green eyes. So, what does a blue eye or a green-eyed person mean? Okay? Kulang sa melanin. Tama ba? Kulang sa melanin. Okay? What else? They have actually, no, they have plenty of your so-called freckles. Ayan. So, skin is light. Okay. Blonde or red hair, blue or green eyes, and of course, Celtics or Irish, okay, have plenty of freckles. Ayan. Okay. Now, exactly, because albinism, less melanin din. Okay, because actually, what protects the skin? What separates, okay, the African Americans? Why are they actually very, very low yung risk for skin cancer? They have melanin. So, albinism as well, no? Albinism is, melanin is also affected there, is also involved. So they are also at risk for skin cancer. Okay, but even though there are some cases of albinism, okay, na may melanin pero konti, kasi dito, it's really more on less melanin. Okay? Next, of course, age is a factor, particularly old age. Okay, old age. And last but not the least, okay? Or should I say, Okay, some of the factors, we have your what? Okay, medications. O, copy niyo muna kasi wala na akong space dito. So, genetics, ethnicity, old age, these are factors. Okay. Yan, glutapamor. O, kopya-kopya muna ha. If you're done, key in the word done. Okay? Now, what are some other factors? Okay? Unusual number of moles. Okay? Unusual or high numbers of moles. Okay? Exactly. Moles. Right? Actually, ang warts, it's really more on moles. Okay? Kasi ang wart, it's more of papilloma. Okay? Or herpes. It's more of papilloma. Cervical cancer. Okay? Now, particularly if the moles are what? Irregular in terms of the shapes, the size, the contour, the color. Okay? Later, tapusin ko na lang to since sa lecture ko na rin. Okay? Next, medications. Okay? Particularly immunosuppressants. The word here is immunosuppressant. So basically, patients or persons undergoing immunosuppressant therapy, okay, they lose their body's capability to fight off cancer cells. The body's ability to defend against cancerous mutations is compromised. Immunosuppressant. Tama ba? Yes. Okay. Now, what are some types? Exactly, transplant and graft kasi magbibigay ka ng steroids dito. Okay, to prevent graft versus host rejection. Tama ba? Yes, but then again, the chances are quite slim as opposed to this one. Okay? What are some types of your tacrolimus? Okay. What are some types of your skin cancer? Most common is your melanoma. Okay. You have your basal and your squamous cell carcinoma. Okay, what's the difference of basal and squamous? Basically, the cells involved, the layers of cells of skin involved. Okay, but what is the most common? Okay, the most common and the most deadly. The most common, okay, and the most deadly type of skin cancer capable of metastasizing. Okay, is of course your melanoma. Ito yung pinaka-common sa lahat. Ito yung deadly. Okay? Capable of invading the lymph nodes, the bloods, okay, the common routes for cancer cells to spread. Okay? Is your melanoma. Please copy, guys. Okay, done? Okay. Let's now talk about the signs and symptoms, the manifestations. Okay, manifestations of skin cancer. Let's use the ABCD method, ABCDE method. Okay? Now, A stands for asymmetry. Okay? A stands for asymmetry. Okay? So, ibig sabihin, pantay o hindi pantay? Hindi pantay. So, dito, okay, when a mole, okay, is actually bisected. When a mole is bisected, okay, bi means what? Two. So, two sides, the two sides, okay, two sides are not equal. The two sides are not equal. Okay, are not equal or identical. Okay, please copy, guys. Okay? And B stands for what? Border irregularities. Okay. So dito, okay, uneven edges. Okay? Uneven edges. Okay? Uneven edges. Okay. And the pigments of the skin starts to fade off. Okay. C stands for what? Color variation or variegation. It means what? Variety. Okay? Or mixture. Variegation means what? Diversity or variety. A combination of colors. So dito, variable mixture. Okay. Variable mixture. Magkahalo-halo. I'm sorry. Variable mixture, okay, of brown, tan, brown, tan, okay, black and red. Okay? Yan. Parang tama, Cobs, parang siwong pinag-uusapan natin. Okay? Mukhang Plants versus Zombies. Ayan, parang siwong. Ayan, so dito. Variable mixture of brown, tan, black, and red. Ayan, tama. Parang pinaghalo na ducklis at saka wong. Duckwong. Ang ending ay parang Jurassic. Ayan, parang kahoy. Okay. Ayan. So, copy-copy muna. Okay? Parang ganito. Wong ducklis. Parang sa lagubang. Parang ganun, di ba? Alam niyo yung kay Pinocchio, yung Jiminy Cricket, yung parang ganun. Ayan. Okay? So, tuloy tayo. Done? Opo. Malakas ang ulan sa amin dito eh. Amoy lupa. Ang layo naman ni Wong ngayon. Si Wong nasa Davao, pero ba't parang amoy lupa dito? Ayan, tapos meron amoy kandila. Daklis, kung saan ka man ngayon, Wong, wag kayo magparamdam dito. Seryoso, amoy kabaong parang si Wong. Langiya. Ang lakas talaga ng rabies ni Wong. Ano? Hanggang dito, naaamoy ko yung lupa. Okay. Tuloy tayo, guys. Next, letter D stands for diameter. Okay, diameter. Yung kamukha ni Daklis. Kamusta na yun, Cobs? Okay, okay, kamukha ni Daklis, no? Okay, alright. Okay, diameter. So dito, greater than, okay, greater than or equal to, okay, sorry, 6 millimeters. Okay, greater than or equal to 6 millimeters. And last but not the least, dati kasi guys, if I'm not mistaken, no, 5 years ago, it's only A, B, C, D. Ngayon, dinadagan nila ng letter E. Letter E stands for evolution or evolving. In some books, it's called evolution. In my reference, it's called evolving. So dito, the lesion, the cancerous lesions actually is changing, no? Okay, continuously changing. Okay, in terms of size, okay, shape, okay, or color. And basically, right, more new lesions. Okay? More new lesions. Okay? Are growing. So please copy mga USRNs. Then later, hopefully, if you have time, let's have a quick rundown in terms of your chemotherapy. The types, I hope you can still remember this. Alkylating, antimetabolites, okay. What else? Your antibiotic, no? Anti-tumors, okay, your alkaloids, plant vinca, mitotic inhibitors. I hope you can still remember this. Okay, if not, guys, okay, sa pharma niyo. Okay, please copy this. If you're done, key in the word done. Okay, guys, can I change this? Mia, okay na po? Sir Ronald, okay na po ito? Okay, tuloy po tayo ha. Okay. Now, genetics, actually, kakasabi lang po natin, but then again guys, do you know that you can take advantage of genetics? Yes. Okay. If cancer runs in your family, okay, should you actually, be particular in terms of early detection? Okay. Of course, for breast cancer, BSE, okay. What else? What are some of your early detection tests and screening? Okay. So BSE, TSE, okay, mammogram, tama. Mammogram, okay. Kakatapos lang po, no? August, okay, breast cancer month, okay, breast cancer awareness month, tama ba? Okay, what else? Your TSE, testicular self-examination. Okay, tama ba? Okay, you have your, what else? Your cancer markers or tumor markers. Tama ba? Okay, your TPSA, tama ba? Okay, now, these are actually, can actually use this in your own advantage. Yes, see, cancer 125, no? Sa breast cancer ba yan? Tama ba? Yes? Okay. Your B2B, no? Your Benz-Jones protein, madami to. Okay? Many to mention. But, I wanna highlight also immune disturbance. Now, sir, immune disturbance, di ba sir, immune suppression to? Immunosuppression. Sir, ano naman yung kinalaman ng immunosuppression? If you are immunosuppressed, di ba you are prone to infection, hindi naman cancer. Okay? Now, here's the question. Okay. So, how does infection or what is the relevance of immune disturbance or immune suppression here? Kakasabi lang po natin kanina. Isang risk factor for skin cancer are immunosuppressants. Nawawala ang capability ng katawan to defend itself from any cancerous mutations. Tama ba? But, infection per se. Can infection actually lead to cancer? Let's find out. Okay. Now, can I erase this? Okay lang po ba? Now, infection. What do you call, okay, what do you call this infection of the urinary bladder? Okay, what do you call this? The urinary bladder. You call this is your answer what? Cystitis. Ibig sabihin, inflammation of the bladder. Urinary bladder. Tama ba? Now, if this cystitis is chronic and recurrent, is there a possibility, exactly, hemorrhagic cystitis, tama ba? Is there a possibility na pwedeng ito mahulog sa cancer? Yes, what cancer? Bladder cancer. Okay. All right. You have your what? Urinary bladder cancer. O, alamin natin ha. Okay. Ito yan. Okay. Now, your urinary bladder, your pantog, no? Sorry. Drawing po natin ha. Okay. Or siguro dito na lang. Okay? Your urinary bladder is actually a reservoir. Okay? It's actually a reservoir for urine. Tama? Ito yung urethra. Tama ba? Okay. Tapos, ito yung urethra. Tapos, ito yung prostate. Tama ba? Here's your prostate. Tama ba? And this is your bladder. It's actually a reservoir for your urine. Tama ba? Now, your bladder, like your GIT, has 4 layers. Also has layers. You have your mucosal endometrial layer. Mucosal. Tama ba? Okay. You have your submucosal layer. Okay, the second layer, your submucosal layer that contains your blood vessels. Okay? Your muscularis layer, yung medyo makapal na layer that contains the nerves. And of course, the fatty covering known as your serosal layer. Tama ba? Yes, detrusor. Ang lalim ni Cobs, no? Detrusor, my goodness. Okay. Ilang weeks na ako, ilang months na ako hindi narinig yung detrusor. Thank you, Cobs. Detrusor. Ayan, okay. Now, tanong. Sir, anong kinalaman ng sesamis dito? O, sabihin natin, na-inflame ang lining dito. Okay? Na-inflame ang lining dito. Remember, okay, your bladder continuously sheds off. Okay? Meron siyang transition area. Para siyang factory. It continuously sheds off and being replenished. Sheds off, replenished. So parang merong factory sa endothelial lining. Yes, guys, eto katulad ng cervical cancer, bladder cancer, pag ang isang organ ay meron parang siyang factory that replenishes lost cells. Question, pwedeng makurap yung factory? Pwedeng makurap? Yes. Instead na meron siyang pattern na yung tama lang ang ipapalabas niya, pwedeng sumobra. Tingin niyo. Yes or no? Yes. Pag merong infection dito at na-inflame to, okay? Yung normal cells dito, pwede ba maging abnormal? Yes. Yung abnormal cells dito, okay, para siyang, tamang-tama, parang siwong. Bakit siwong? Leader ng kulto, si Daklis, ministro, parang ganito. Ano bang ginagawa ng dalawang yon pag walang lecture? Okay, nagre-recruit. O halimbawa, okay, pwede bang i-recruit ng cancer, no? Okay, si Ronald, si Kobe, si Mia, okay, pwede po ba? Yes, nadami sila. Okay, sumali kayo sa amin. Now, itong inflammation from one single cell, pwede ba siyang capable ba siyang mag-mutate ng other cells surrounding? Yes, nadami siya. Pag dumami, anong sasabihin niya? Makakagrupo ko. Okay, mag-group hug tayo. Once mag-group hug sila, you now have a tumor or neoplasm. Ganun ba yan? Yes or no? Cell cycle, di ba? Yes. So, merong tumor mag-form dito. Starts with inflammation, irritation. Okay? Eventually, a group of cells clumping together, abnormal cancer cells, can form a neoplasm. Now, question. Okay, you have your ihi. Okay, you have your tumor here. Here's the question. Okay, common exam question to. They would usually love to ask you, what are the common or the early signs, the late signs of such particular cancers? Nurses, you have to know this. What is the early sign, pathognomonic sign, classic sign of bladder cancer? Please answer. You have to know this. What is the earliest sign of bladder cancer? Your? Okay? Hematuria. Sir Ronald. Okay. Miss Mia. Cobes. Everybody. Okay. Romelin. Okay. Ang tanong dito, anong klaseng hematuria ang pinag-uusapan natin? Painful or painless? Painful or painless? Early. Painful or painless? Cobs, sumama ka na rin ba sa kulto? Okay. Nawala si Kobe? Okay. Giovanni, painful or painless? Tanggalin ang question mark. O, alamin natin Dito muna sa akin. Okay. Now, ano yung pattern ng tumor spread dito? Ascending or descending? Descending, bababa ito. Now, anong pangalawang layer ang tatamaan niya? Okay? Blood vessel. Pag tinamaan yung blood vessel, would there be bleeding? Yes. Lalabas ba si blood? Yes. Hahalo kay ihi? Yes. Ito na ba yung tinatawag ng hematuria? Yes. But here's the question. Painful or painless? The answer here is painless. Sir, bakit ka mo painless? Kasi ganito. Ano bang unang tinamaan dito? Kasi, eto naalala ko lang, I have a student in Cagayan de Oro. Okay? Actually, USRN na siya. One time, okay, nagbisita siya sa amin sa isang particular na pinatrabahuhan ko doon. Sabi niya, Sir, thank you. I'm already a USRN. Okay, sabi ko, congrats. Pwede mo bang i-share yung mga lumabas? Actually, sir, ito, senior niya yung mga topics na lumabas. Tapos sabi niya, "Sir, I have one question. I was actually answering a particular Saunders exam question. Traditional lang siya. Okay, hindi siya SATA. It's only a traditional question. Sir, it was about bladder cancer. Actually, I have a screenshot. So pinakita niya sa akin. Sabi niya sa akin, Sir, bladder cancer, oh. Pero sir, mali yung painless. Yung tamang answer, painful. So tiningnan ko. Sabi ko, dude, tama, no? Painful nga lumabas dito. Eh yun nga sir, yung tinuro mo sa amin, painless. Eh how come eto sa Saunders painful? Ang tanong dito, sabi ko sa kanya, pero mawalang galang na, binasa mo ba yung question? Kasi nakalagay dito, the question there is, what is one sign that bladder cancer is advancing? Hindi naman early yung tinatanong dito eh. Pag early, it's painless. Now, if this cancer advances, will this actually eventually hit the nerves? Yes or no? Yes. Sa makatuwid, pag yung painless naging painful, okay? Pag yung painless naging painful, early yon or advancing? Advancing. Make sense? Tama ba? So moral lesson ni sabi niya, ay tama sir, no? Hindi ko kasi nabasa kasi nakita ko dito bladder cancer tapos yung ginawa ko dumiretso ako dun sa choices kasi it's only words, no? Painful, painless, yung ganun lang. Okay? Exactly. Pag the nerve is already affected, it's not already early, it's already advancing or late. Even though the late sign of bladder cancer is not only this one, but it's actually low back pain. Aside from painful hematuria, which is actually a late sign and a sign that the cancer is advancing, low back pain is also a late sign. Alam niyo kung bakit? O, dito muna. Okay. Ano ba yung mga common na sites for cancers to grow or to form a secondary tumor or metastasize? Your BBLL. And BBLL, Kobe, naalala mo ba to? BBLL stands for what? Your brain, bone, liver, and lungs. Naalala nyo to? Yes? Okay? Ito sites, tambayan. Tambayan at mag-grow ng panibagong tumor. Okay? Ito naman ruta, routes. Pag sinabing routes, daanan. What are the common routes? You have your CSF, you have your blood, and you have your lymph nodes. Ay, sorry. Choppy po ba yung ano ko? Okay lang po ba? Ada choppy ba ako? Pasensya na medyo, hindi na ngayon malakas yung ulan dito, pero pag naulan kasi dito, medyo mahina. So please call my attention. Princess, okay lang ba? Naririnig ako? I think merong video ito. Okay lang po yung signal, hindi naman putol-putol. Sir Ronald? Okay, alright. Balikan natin ha. Dito muna tayo. Okay. Now, common na ruta. CSF, blood, and lymph nodes. Okay? Sir, bakit CSF? Tanong, dumadaloy ba ito dito sa brain and spinal cord? Yes. Kaya minsan, magugulat kayo. Okay. Breast cancer, pero lumbar puncture ang ginagawa. Bakit guys? Now, breast cancer, lumbar puncture, ang layo naman. Anong kinalaman? Guys, if you have breast cancer, okay. Prince, check mo na lang mamaya yung recording. Now, napapansin niyo to. Breast cancer pero lumbar puncture ang ginawa. Ang layo naman, sir. Why? Tanong. If you have breast cancer, is there a possibility for metastasis? Yes. Is the brain one of the common sites for metastasis for another tumor, secondary tumor to grow? Yes. Kaya pag chinek itong lymph node, ang CSF via lumbar puncture at positive itong CSF sa cancer cells, pwede bang meron ng glioma or brain tumor na tumubo dito? Yes or no? Yes. May cross the blood-brain barrier. Now, you have the blood. Bakit? Ano bang sumasala sa blood ng isang tao? Di ba liver? Tama ba? Now, dumadaan ba itong blood sa liver, even the bones that has small blood vessels and nerves? Yes or no? Yes. Here's the question. Alin dito ang pinaka most common sa lahat? CSF, blood, or lymph nodes. Pinaka-common na daanan. CSF, blood, or lymph nodes. Most common. Sagot, bilis. It's almost panghapunan. Okay, the most common is your lymph nodes. The fastest, on the other hand, is your blood. Kaya minsan breast cancer pero tinutusok yung kilikili. Bakit? Ano bang meron sa kilikili? Axillary lymph nodes. Tama ba? Now, but then again, konting reveal lang to. But then again, what are the common sites or tambayan? BBLL, and BBLL stands for what? Brain, bone, liver, and lungs. Balikan natin yung lecture natin kanina. Okay lang? Balikan natin. Now, earliest sign is painless hematuria. Aside from painful hematuria, okay, why is low back pain? In bladder cancer, why is low back pain a late sign of bladder cancer? Tingin niyo, bakit to kaya? Why is low back pain a late sign of not only bladder cancer, testicular cancer, even prostate cancer? Question, do you have a bone surrounding your pantog, your pelvis, your pantog? Do you have a bone there? Yes. Do you have the pelvic bone that surrounds your bladder? Yes. Is the pelvic bone a common site for secondary tumor to form metastasis? Yes. Are we learning? Yes? That's why usually, karamihan, bladder, testicular, prostate cancer, sa lalaki, even sa babae. Mas common sa lalaking bladder. Okay? Now, sir, bakit low back pain? Okay? Because basically, ano bang meron doon sa testicles niyo, malapit sa testicles niyo? Ano ba yung bone na nagsusurround doon? Meron bang bone that surrounds your urinary bladder? Your testicles? Okay. Your prostate is actually near your urinary bladder? Yes. Anong bone? Pelvic bone. E di low back pain. Make sense? Mga USRNs, make sense? Okay, tuloy natin. Okay. So, going back, erase na to going back, infection, cystitis really plays a role. Pwede po ba? Pwede, ano? Yes. Okay? Alright. O, review natin Infection. Pwede ba? UTI? Lalo na pag chronic and recurrent, pwede bang mahulog sa bladder cancer to? Yes or no? Yes or no? Yes. Cystitis, a UTI, okay? Pag chronic and recurrent, okay, lagyan mo ng nicotine, ng yosi, okay? Basically can lead to what? Cystitis, UTI of the bladder. Pag paulit-ulit, pwede bang mahulog sa bladder cancer? Yes, bladder cancer. And if the question asks you, nurses, if the question asks you, what is the earliest sign of bladder cancer? Okay, earliest sign? Okay, hematuria. Exactly, Cobs. Hematuria. Anong klaseng hematuria? Painful or painless? It's painless hematuria. Are we clear? So, does infection here play a role in some of the cancers, particularly bladder cancer? Yes or no? Yes. Tuloy natin. Okay? Oh, ito pa, infection infection. Okay? Infection. Now, cervical cancer. Okay. Cervical cancer. What infection? Okay, or how does infection play a role here? Oh, can you name some risk factors for cervical cancer? Can we say early age of sex? Yes. Can we say multiple sexual partners? Yes. Can we say STDs? Yes. Can we say infection? Opo. Anong klaseng infection? Viral infection. What viruses, okay, are actually responsible for cervical cancer? You have your HPV and your herpes simplex virus. O, teka lang. HPV, HSV, can this actually cause viral infection? Yes or no? Lalo na pag immunosuppressed yung pasyente. Exactly. So, does this play a role? Yes or no? Yes. That's the reason why pap smear is very important. Which reminds me, pap smear. Okay? Okay, is this confirmatory or early detection? Confirmatory or early detection? Early detection, because basically what will confirm is always biopsy. Okay? Whether incisional, excisional, or, needle, fine needle aspiration. Tama ba? But going back here, meron infection, HPV, HSV. Does this play a role in some cancer? Yes or no? Yes. Which reminds me, between papilloma, HPV, and herpes, alin ditong pinaka-common na pwedeng mahulog sa cervical cancer sagot? HPV or HSV? Papilloma, okay, or herpes? Excellent, Camille. Kaloy, okay, Sir Ronald, it's your HPV. That's the reason why pap smear with HPV testing, okay, is very, very important. Are we clear? All right? Okay. So, dito, okay, what is the ideal age for pap smear in your books? Okay, 20 years old, no? 20 to 39 years of age. Okay? At ang sinabi dito, okay, pero guys, non-specific to, okay? Pap smear should be done after the first sex. Kaya nga po, no, pasintabi po, I hope I won't be offending anybody, ano. Napapansin niyo po sa mga rape victims, lalo na po sa mga bata, mga minors, okay? Aside from checking for the semen, kasama po yung pap smear, ano? Okay? Pap smear. Kasi basically, sir, ano pang kinalaman dito ng multiple sexual partners sa HPV, HSV? Guys, if you have multiple sexual partners, okay, or during the first sex, are you actually exposed to HPV, okay, and HSV, STDs? Yes. Multiple sexual partners, early age of sex. Ang bottom line, babalik pa rin po dito. No problem, no problem. Okay? Now, tapos ang sabi daw nila sa libro, okay, when the woman begins to be sexually active. Tama? Pero dito kasi, para siyang irrelevant kasi pag tinignan mo, paano mo malalaman na sexually active or hindi yung isang babae? Sasabihin ng isang babae, sir, hindi ako sexually active. Yung husband ko is seaman. Opo. Pero, nandun sa kabila si kumpare, di po ba? Yes, tama. Okay, si kumpare, ayan. So, hindi nga siya active kasi wala yung husband niya. Pero, well, ibang usapan. Tama? Okay? Biro lang, biro lang. Kaya dito guys, ideally, 20 to 39 years of age, as long as normal. By the way, how often is this done? Okay, how often is this done? Okay. Right? Okay, so how often is this done? This is done every 3 years. Okay? Every 3 years as long as the results are normal. When the woman is about 40 years of age, yun na po yung yearly. Okay? But what am I trying to say here? Pap smear with HPV testing is very important to detect cancerous lesions, to check for the development of warts. Having warts doesn't necessarily mean you have cancer, but these warts, these lesions, are this actually potentially cancerous? Yes or no? Yes. Are we clear, USRNs? Yes? Okay. All right. So meron po ba? Meron po ba itong relevance, itong immune disturbance, infection in the development of some cancers? Yes. Okay. O, isang example na lang. Last example, ano? Can I erase this? Sir, infection. Paano po? Anong cancer? O, teka lang. Guys, your lymph nodes. No problem, no problem. Okay. Anyways, may video naman at saka, dude, you can message me anytime. Hopefully, makatulong to kahit paano, ano? Basta for the meantime, kayong mga USRNs, soon to be USRNs, relax lang. Okay, chill, just enjoy this. Enjoy review at magdasal lang, awa ng Diyos. Pagdating ng panahon, guys, you will pass your board exam. Kasi dito, ang kagandahan dito, wala na kayong pressure na kailangan kong taasan, okay, na maging top notcher kasi wala yan dito. Okay? You just need to make sure, okay, that once you open your accounts, you would see those that word, no, that states you passed. That's the goal here. At sana hindi ko na kayo makita sa next klase ko kasi ibig sabihin nun, mga USRN na kayo. Ayokong paulit-ulit na lecture dito kasi iba sumasabay na sa lecture ko. Tama ba? Ayan. So hopefully, yun, ganun na. Alright? Expected. Tama? Okay. Ayan. So, lymph nodes, guys, is this a part of your immune system? Yes or no? Yes. So if the immune system is actually active or compromised, does this actually play a role? Lymph nodes? Yes. Meron bang cancer dito? Okay, dahil sa lymph nodes? Yes, meron po. Lymphoma. So in any angle, infection really does play a role, does it? Yes. If a patient is chronically or recurrently undergoing infection, immunosuppressed, is that patient a good candidate for lymphoma? Hodgkin's or non-Hodgkin's? Yes. Lymphadenopathy. Lumalaking lymph nodes. Pwede bang hindi na siya mag-shrink? Yes. Kung napapansin nyo, galing ka sa duty. Okay? 16 hours na duty. Tapos naulan. Okay? Nabasa ka, wala ka pang tulog. Anong ending mo? Okay? Generalized infection. Napapansin po ba? Okay, nangangalay dito, dito, tas sa singit. Yes, bakit? Anong meron doon? Lymph nodes, cervical, inguinal, axillary. So basically, lymphoma is a possibility. Are we learning? Okay, next. Okay, let's talk about race. Okay, now, before chemical agents, no, let's talk first about race. Now, when you say race, no, there are some cancers na specific sa race. Okay. So dito, pag sinabing prostate cancer, okay. At pag sinabing, sabay na lang po natin to multiple, okay, multiple myeloma. Okay, anong race ang karaniwang tinatamaan? Okay, white Americans, Caucasians, or African Americans? Okay, African Americans. Okay, bakit guys? Okay, African Americans. Okay, bakit guys? Kung naalala nyo, what hormone, okay, what hormone here is responsible for these cancers, for this prostate cancer? Testosterone. Kung napapansin nyo, with all the respect, okay, lahat ng lalaki mayroong testosterone. Pero sino ang mas malaking body build sa mga NBA players? Okay, yung mga African American. Tama ba? Okay, so with all the respect, malaki ang ari, malaki ang katawan. Tama ba? Okay, yung ano naman, ang mga Asyano, hindi ibig sabihin, di po ba? But hormones here actually plays a role. BBC. Anong BBC? Okay, banana Q. Okay, or banana C. Ayan. Guys, huwag niyo ko gamitan ng mga pang-millennial na mga terms guys kasi batang 80s yung sa amin, yung mga CTC, mga LOL, where na you, hear na me, yan. Sila Daklis, yun, mas matanda pa yan, sila Wong. Okay, sa akin Nokia, sila Daklis, walkie-talkie, ayan, yung mga Ericsson, yung parang malaking telepono, yun, yung kapanahunan nila Wong at saka nila Daklis. Okay, so ayan, pasensya na, hindi ako makaintindi sa mga terms nyo. Okay. Bago ngayon, tapos meron pa mga, napapansin ko to sa klase ko palagi. Pag nagle-lecture ako, pagkatapos ng lecture ko, magsasabi sila ng, sheesh, sheesh, sheesh. Dati sa amin, sus Mariusip, tapos ngayon, sheesh. My goodness, dami kayong codes, para kayong kulto. Sheesh. Okay. Alright. Dati akala ko sheesh, no? Sheesh Mariusip. Ganun ba yun? Okay? Basta yun lang. Guys, yun. Okay? Alright. Kids, na-erase ko na ata. Ito ba yun? Okay. Alright. Okay na to? Okay. Now, so going back here, no, African Americans. Okay? Now, on the other hand, when you say testicular cancer, okay, and let's include skin cancer. Saan common to? Sa blacks, with all due respect, no, sa blacks or sa whites? Common ito sa whites. Sa Celtics, sa Caucasians. Tama po ba? Yes. Those people who have less melanin. Okay? Between whites and African Americans, mas common si prostate cancer sa African Americans. Okay? Now, but between testicular cancer and skin cancer per se, okay, mas less ang chances ng African Americans na makakuha ng cancer, skin cancer, as opposed to the white people. Alright? Okay, so please copy, nurses. Then we'll finish this muna para mamaya, natapusin ko lang ito para mamaya, gagawin natin to save time because I cannot go more than 9 p.m. Okay? Alright, so hopefully 9 p.m. or earlier than that, matapos natin yung lecture natin, ano? Okay, alright. Can I erase this? Okay, let's now talk about, okay, your chemical agents, your aromatic amines, your nitrates, your PVCs, your lead, your benzene. Tama ba? Melanin concentration lamang AFAM. Okay, hindi ko gets yun pero ayos. Okay, now, what is the triad of cancer? Okay, the triad of cancer. Okay, so pag sinabi kasing triad, tatlo, no? Okay, your triad of cancer is known as your ASA. Okay. Your ASA. And ASA stands for what? Okay, ASA stands for what? Uunahan ko na, hindi an aspirin. Okay, ASA stands for what? Okay, all right. Alcohol, smoking, and of course, asbestos. Amy. Anong Amy? Mnemonic ang Amy? Naririnig ko yan, Amy. Bahala kayo, ha? Okay? Hindi ko magets. Okay. Okay. Parang joke. Tapos meron pa yung may char. Okay, may char, may Amy. Dati naalala ko sa may estudyante ako, palaging char. Sabi ko, nagbibenta ka ng uling, charcoal, ganun. Okay? So, ayan. Okay. Char, ganun. Sabi ko, sir, question lang ako sa ganyan. Char. Tapos, okay. Tapos, char. Sabi ko, cool. Uling? Okay. Di ako nagbibenta ng uling. Okay. Amy is like kidding. So, how do you use it in a sentence? Ganito. Amoy lupa. Okay. Siwong. Amy. Yan ba yun? Okay. Or amoy lupa si Dakles at saka siwong. Hindi ako nag-eme. Ayan, di ba? Pwede. Ayan, okay. Alright. At least may nalaman ako na bagong word. Okay. Ayan. Galing sa Ataul, siwong. Hindi ako nag-eme. Ayan. Hindi ako nagjo-joke. Ayos. Okay. Wait ako sa inyo. Thank you. I'm learning. Okay. Alcohol. Okay. Tama na, ha. Okay, ayoko na sa may bago pa, Kimi. Okay? Now, alcohol, okay, this can lead to what cancers, guys? Okay, chronic, I'm sorry. Okay, alcohol can cause what cancer? Okay, GIT cancers, intestinal cancers. Okay, GIT or intestinal cancers. Okay, what else? Alcohol, excellent codes. Okay, this can lead to liver cancer, okay, liver cancer, and okay, this can lead to cirrhosis. Cobs, total, you brought it up, okay, since binunot up ni Kobe. Okay, Cobs, tanong, pag sinabi pang liver cancer, ito ba liver cirrhosis? Kasi karaniwan sa probinsya naririnig natin to. Ay si Mang Dodong, no? Si Sir Wong, okay? Nagka-liver cancer, ay cirrhosis. Ba? Pareho ba yun? Are they one and the same? Kasi pareho may manifestations. Okay, si liver cancer and liver cirrhosis both have portal hypertension, hepatic encephalopathy, pwede, di ba? Kapot ni Dose, spider nevi, tama ba? Yes, ascites. Okay? Now, here's the question. Are they the same? Yes or no? Hindi po. Kasi like we said, liver cancer, the cause is actually unknown. Sir, teka lang. Akala namin alcohol o baka nakalimutan nyo. Alcohol could be one of the many triggers or factors. But the cause of cancer is unknown. Etong liver cirrhosis, pag sinabing alcohol ang rason, alcohol talaga yan. As a matter of fact, may pangalan to. Di ba? May pangalan to. Anong pangalan nito? Lenix. Tama ba yung spelling ko? Lenix cirrhosis? Yes? Okay? Lenix cirrhosis. Kasi basically, right, cirrhosis and liver cancer are quite different. At tama, cirrhosis can play a triggering factor for cancer. It can lead to cancer. But then again, liver cancer and liver cirrhosis are not the same. They might actually mimic each other's manifestation, but they are not one and the same. Are you following? Yes. Now, okay, next. Okay, next. Smoking can cause, we all know this, okay, your so-called lung cancer. Okay? That's why in your cautional, okay? One of the, there is a nagging cough, no? The end there is nagging cough or persistent cough, hoarseness. Okay? Smoking can also cause bladder cancer. Smoking can also cause cervical cancer. Actually, itong smoking, okay, itong smoking, guys, all right, it's almost everywhere. Tama ba? Okay, number one risk factor, kaya tinawag siyang part of the triad, okay, of cancer. Tama? Okay. As a matter of fact, this is number one. Except for cervical, because between smoking and HPV, dito naman, HPV is number one. Nakukuha? Number 2 lang or number 3 lang ang smoking dito. Pero sa bladder cancer, okay, alam niyo ba between UTI and smoking, mas matindi, okay, na risk factor itong smoking as opposed to UTI? Yes. The nicotine can actually go together with the blood. Okay, so basically the patient's blood is full of nicotine. Now, saan ba sumasala or saan ba sinasala, okay, itong dugo ng pasyente ng tao? Sa urine. Tapos diretso ng blood. Is there a possibility na pwede mag-leak from the blood to the urine itong nicotine? Yes or no? Yes. Sa mga smokers, ako hindi na, okay? Awa ng Diyos, natanggal ko yung yosi, vape na lang. Okay? So hindi na siya yellow yung finger ko. Okay? Yes, dahil sa Baguio. Okay, syempre sa Baguio, pag nahuli ka doon, hindi multa, no, civil service. Okay? So can you imagine? Okay, nagwawalis ako doon. Tapos yung mga estudyante dumaan na, "Sir, good morning." Okay, tapos, "Guys, tapusin ko lang ito." Tapos pasok ako. Nakakahiya. Kaya tinigil ko yung yosi. Eventually, awan ng Diyos, since March. So hanggang ngayon, hindi na ako natila ng yosi. So vape na lang. Thank you. Ayan. Okay. Ayan. So hopefully, matanggal ko rin ito. Okay? Vape na may straw. Roar. Okay, hindi ko magets. Okay? Ayan. So going back here. All right. Mas matindi itong sa mga smokers, tinaning daliri nyo. Dati makuubos ako mga dalawat kalahati, minsan 3. So napansin ko dito yellow yung smoking finger ko. Okay? Ganon din yung principle. Okay? It's actually yellowish. Can you imagine that? Okay? That nicotine adhering to the lining of your urinary bladder. Can this actually cause the normal cells comprising your bladder to become inflamed, irritated, and abnormal? Yes. Okay, depende sa yosi. Okay. Hindi naman matapang kasi Marlboro Lights yung ginagamit ko. Pero ang sabi daw, mas malakas ang epekto ng lights compared sa red. Kasi sa red, tamang hahagod lang. Sa lights, pagbitin, okay, sindi ka ng sindi. Anyways, that's another story. The point there is, can this nicotine adhere in the urinary bladder? Yes or no? Yes. Kaya mas matindi itong yosi as compared to other factors. And of course, last but not the least, you have your asbestos. And asbestos can cause, okay, this can cause lung cancer. Dati, ginagamit ito as raw material kasi it's a very, exactly, cal, ards, madami. Okay, pero lung cancer talaga eh. Okay, because once this adheres with the alveoli, the air sacs of your lungs, it's very, very adherent. It's very sticky. Ngayon, meron ng batas na nagre-regulate sa paggamit nito kasi, okay, it was found out that this is a very potent carcinogen. Okay, and this can cause lung cancer. Okay? Exactly. Hardens the alveoli. It sticks and it never lets go. It becomes hardened. Okay? Eventually, necrosis of the alveoli will occur. Okay? And this can lead to lung cancer. Nakukuha po ba? Yes. Let's just finish this before we have our supper. Okay lang ba? Exactly. Atelectasis, lung collapse, or even tracheal deviation. Okay? Now, okay. Last but not the least, let's talk about diet. Okay. What type of diet, what type of fat diet can actually lead to breast cancer? Okay. Prostate cancer among the many. High fat or low fat? Of course, it's high fat diet. Okay? High fat, particularly those of the category ng red meat. So when you say red meat, beef. Yung chicken po ba ay meron ding red meat? Opo, sa paa. Okay? Sa leg part. Tama? So red meat actually increases the possibility not only of breast and prostate but also colorectal, colon, okay? Or let's just put this, no? It's a colorectal CA. Okay? This can even cause bladder CA. Okay? Or some GIT. Okay? GIT cancers. Okay? High fat diet, okay? And red meat. All right? Red meat. Now, next, what type of fiber and residue diet increases the chance of having these cancers, particularly GIT cancers, intestinal cancers? High fiber or low fiber? Low fiber diet, okay? Low residue diet. Why? Low fiber and low residue actually leads to what? Decreased peristalsis. So if this decrease ang peristalsis, what's the end game there? Constipation. Okay, pasintabi po sa kumakain na, tayo po ay nagbe-breakfast, nagla-lunch, and supper. Okay, not to mention our in-between snacks. Pag hindi ka dumumi the next day, saan po ito pupunta? Can this adhere at the lining of your colon, of your intestine? Therefore, okay, polyps might actually grow out of this. Yes or no? Yes. Polyps in your colon. Okay, in your intestines. Tama? So dito, how do you promote, no? How do you lessen the possibility of cancers? Baliktarin mo lang ito. Low fat, high fiber, high residue diet. Increase roughage. Exactly. Are we learning, nurses? Yes? Okay. Let's have ano na pagtaas? Okay? All right. Okay lang ba guys? 2 hours na. Pahinga muna tayo. Let's have supper first. Okay lang po ba? So I'll see you in 20, no? Or maximum 30 minutes. Tapos ang gagawin ko mamaya, lecture ako ng konti pag may oras pa pagkatapos ng post-test. Tapos as we post-test, we ratio lecture, ratio lecture. Okay? Enjoy your supper, my fellow USRNs. Okay? I'll see you in 20. Okay? To 30 minutes. Enjoy your supper. God bless. Thank you. Guys, are you here? Okay, host, if you're there, paramdam po, I'm trying to call you sa cellphone. Saan na sa may messenger? Sir Lawrence? Okay.
Good evening po, sir. Si Sir JB na po to, sir.
Sir Jabe, good evening po.
Apo.
Sir,
Good evening po.
good evening po. Bigyan na lang siguro yung exam ngayon, sir. Tapos,
Okay po,
okay
sir.
na ba, guys? Paki-post na
Apo,
lang yung exam.
posted na po.
Yeah,
Posted na po, sir.
posted na po. Posted na. Sige po. Tapos pagkatapos mamaya raso namin, raso lecture. Thank you, guys.
Sige po, sir. Sige po.
Sir, please message me kung okay na ha. Okay,
Sige po,
kakapost
sir.
lang po. Kakapost lang.
Apo.
Sige po. Thank you. Mga 20 minutes siguro okay na yun, no? Maximum 30 minutes. Thank you. Okay, guys, are you done? Okay na ba tayo? If you're okay, guys, kindly key in the word done so we can start. Let's just lecture and ratio. Okay? To save time. Okay, done. All right. So if you're done, kindly open your cameras. We can answer this. Okay? All right. Okay, done na? Okay. All right. So number 1. Okay, so we have SATA questions here. Meron dyan sa number 13, I think it's a prioritization question. Sige lang, ang importante guys is the knowledge will be able to come up with this ratio. Okay? Now, the family practice nurse clinic, the family practice clinic nurse is conducting a client intake histories which client finding or histories indicate a need for heightened concern that the client may have cancer. Okay. So guys, okay, what are your answers here? Kindly key in your answers, guys. Kindly key in your answers. Okay, what are your answers here? Okay, the answers here are, okay, isa-isay natin ha. Oh, okay, what about the others? Okay, so select all that apply ang question na to SATA. Okay, so what are your answers? What about the others, guys? Okay. What about the answers of others, guys? Kindly key in your answer. Type your answers. Okay? So before we go here, right? CNE. Okay, Sir Ronald, anong answer mo dito? Sige, sige. Habol lang, habol lang. Okay. So there are 51 of you here, only hindi umabot ng 10 yung uma-answer. Okay, so key in your answers. No problem. Just key in your answers. Regardless of the points, it doesn't matter. What matters is the learnings here. Okay. So before we answer this, let's talk first or review first the warning signs of cancers. Okay? The warning sign of cancer. Okay? So let's use the mnemonic caution us. The 9 warning signs of cancers. Okay? The mnemonic caution us. The 9 warning signs of cancer. Okay? Now C actually stands for what? Okay, it change. Okay, change in the bowel, okay, or bladder habit. Change in the bowel and bladder habit. So bowel, this could mean what? Colorectal cancer. Bladder, this can cause what? This could mean bladder cancer. Now, what about A? A stands for what? A sore, okay, that doesn't heal. Tama ba? Okay, a sore that doesn't heal. Tama? Let's just review this. Now, U stands for what? Unusual bleeding or discharge. Okay. Unusual bleeding or discharge. Okay, so this pertains to cervical cancer. Tama ba? Okay. Now, T stands for what? Thickening in the lump. Okay. Thickening of a lump. Okay, in the breast. Okay, in the breast or elsewhere. Tama ba? Okay. While I stands for what? Indigestion. Okay. Indigestion. So this could mean what? Okay, intestinal cancers. Tama ba? Okay, copy mo na guys kasi blackboard ang ginagamit ko. Baka ma-erase. Okay, indigestion or difficulty in swallowing. Dysphagia. Okay, there you go. So copy mo na. Pagkatapos, natin to. Okay, if you're done, key in the word done. I'll give you time to copy, guys. Pasensya na, wala akong handouts by the way. Kasi pag may handout, baka hindi ko maubos. Mas okay na to na kung ano yung ma-lecture natin. Okay? We only have 4 hours kasi. So I hope na I'll give you time to copy. Take a screenshot. I'll give you time to copy. Okay, done? Okay, paki-screenshot na lang po if ever na medyo may lagging dito. Okay? Kindly put the screenshot in the chat box. Okay. Now, O stands for what? Obvious change in a wart or mole. So obvious change, okay, in a wart or mole. So dito, obvious change in a wart or a mole. Ito, it could be cervical, no? This could be cervical, while the mole pertains to skin cancer. Kanina ko naalala na sa A, B, C, D, E natin. Tama ba? Yes. Okay. Now, N stands for what? Nagging or persistent cough. Nagging cough or persistent cough, or basically, for laryngeal cancer, it's chronic hoarseness. Okay, chronic hoarseness. Okay? Now, U stands for what? Unexplained anemia. Unexplained anemia. Okay? So this could be okay, or weight loss. Yes, unexplained anemia or weight loss. So this could be what? This could be blood cancers, it could be leukemia, it could be multiple myeloma. Unexplained weight loss, this could be what? So dito, this could be blood cancers. Okay, this could be because of blood cancer. Unexplained weight loss could be a sign of lymphoma or Hodgkin's. Okay, while your nagging cough could be a sign of lung cancer. Okay, hoarseness could be a sign of laryngeal, okay, laryngeal cancer. Okay, and S actually, tama, sudden weight loss. Sudden unexplained weight loss. Okay, so these are signs of your what? These are the 9 warning signs of cancer. Okay, the 9 warning signs of cancer. So if you're done, let's go back to the question. Okay, are you done? If you're done, key in the word done, guys. Please copy or take a screenshot. Okay, done. So isa-isahin natin to. A 60-year-old client was just diagnosed with BPH, benign prostatic hyperplasia. By the way, is BPH cancer? Yes or no? No, because the word here is benign. Tama ba? The word here is benign. So letter A is a part of it. Okay? Kanina, I did mention to you. Okay? I did mention to you that we're gonna review. Okay? What's the difference of a neoplasm, either benign or malignant? So let's do this. Okay? Let's review the difference of your benign and malignant. Okay? Now, dito muna ha. Okay. Let's review the difference of a tumor, no? In terms of benign or malignant. Okay? There are actually 2 types of tumors. One is your benign, okay, so tumors or neoplasm, ano? Tumors, okay, or neoplasm. Let's try to distinguish your tumors. Okay? Dalawang klase, you have your benign and the other one is malignant. Okay? Let's distinguish this in terms of growth type or growth rate. Okay, what else? Differentiation. Let's try to distinguish a benign tumor from that of a malignant one. Okay, differentiation. So, eto benign, eto malignant. So, anong difference ng dalawang ito? Alamin natin. Okay, next. Capsule, kung sino ang may capsule sa dalawa. Okay, what else? Okay, in terms of location. Okay, in terms of growth type. Okay, let's distinguish benign from malignant tumor. And of course, let's try to add here recurrency. Let's say it is actually removed by surgery, which will recur. Okay, which is more likely to recur. Okay, now the growth rate of a benign tumor, okay, is actually slow. As opposed sa malignant na mabilis talaga. Okay? What about the differentiation, anong composition ng isang tumor na benign? Kasi pareho itong lumalaki. Okay? Now, benign tumor composes, okay, is composed of well-differentiated cells. Okay? Well-differentiated. Ibig sabihin, magkakapareho. Hindi exactly na similar, ano? Okay? But if you try to look at them under the microscope, okay, you would still determine, the doctor would still determine, okay, magkakapareho to. Hindi sila ganun kapareho in terms of size, no? Not exactly alike, but kilala pa ng doktor kung anong klaseng cells ang nilalaman ng isang benign tumor. That's why alam natin yung delikado malignant, yung chill dito is benign. Okay? Kasi dito, if you actually get a sample of a benign tumor cell and put it under a microscope, the doctor can still figure out kung anong klaseng cell yan. It's well differentiated. Delikado ang malignant because it's actually poorly differentiated or undifferentiated. Dito, nabibilang ang metaplasia, anaplasia. So dito, hindi nakilala ng doktor kung anong klaseng cells ang nilalaman ng malignant. Neoplasia, new cells are forming. Metaplasia, okay? So anaplasia, ito yung mga delikado. Okay? Now, sino ang may capsule dito? Benign or malignant? Of course, benign. Sino ang walang capsule dito? Okay, of course, is malignant. Now, in terms of location, itong benign is localized. Kung saan siya tumubo, okay, itong benign tumor, dun lang siya. It's localized. Okay? While your malignant location, it's everywhere. It has the capability to spread or metastasize. Okay? Now, ano naman yung growth type nitong benign? It's growing, but then again, it's growing expansively. While the growth type of your malignant is, it's capable of what? Okay, invading, okay? It's capable of invading, it's invasive and infiltrative. This can infiltrate or invade other tissues or organs to form a secondary tumor. Okay? Next. Okay, recurrency, it's quite rare. While the recurrency, the possibility of a malignant tumor to recur is quite high. It's increased. Okay? Mas mataas yung chance, increase yung chances na pwedeng tumubo uli itong malignant tumor niyo. Okay? Alright. So please copy guys, then let me explain this. And we can go back to the question. Okay? Kung letter B, tama ba yun? Is it actually cancer? Alamin natin. Okay, if you're done, let's key in the word done. Explain natin pagkatapos. Copy muna, take your time. We still have 45 minutes. So that's plenty of time for a 20 items na question. Okay, now, dito muna. Alam natin, delikado yung malignant. Cancer to. Itong benign, medyo chill-chill. Bakit guys? Okay, simplify natin ha. Okay, sa kinopya nyo dito, pwede nung i-memorize. Pero why memorize if you can simplify? What am I saying here? Pumili kayo dito ng isa. Isa lang. Okay? That will basically distinguish benign from malignant. Tingin nyo. Ano yun? Capsule kikaloy. What about the others? Isa lang piliin nyo dyan and everything will make sense about malignant and benign. Growth rate, capsule, location, growth type, recurrency. Okay, growth rate kay Ruby. Okay, differentiation, location kay Michelle, kay Crystal, location din. Okay, recurrency, kay Eunice. What about you, Ronald? Romilin? Okay, growth rate. Guys, sa question ko na to, walang maling answer kasi either way, kung anong pipiliin niyo dyan, tama naman kasi nandyan yan. Ang gusto ko lang malaman dito is you have how you simplify things. Okay, gagamitin ko yung sinabi ni Kaloy. Yung sabi ni Kaloy is capsule. Okay. Now, dito muna, capsule ang sabi ni Kaloy. Okay. Depende kasi kung saan kayo komportable. Regardless of your answer, it's also correct. Now, sino ang delikado? Benign or malignant? Malignant. Bakit? Wala ba siyang capsule? Yes. Wala bang capsule na pumipigil? O, alamin natin. Delikado ba si malignant dahil mabilis ang pagkalat? Pwedeng mag-spread at mag-invade dahil walang capsule na pumipigil dito. Yes. At pag tinanggal mo, let's say surgery, surgery, you remove a particular malignant tumor. nakakasigurado ka bang walang natira dyan na cancer cell dahil walang capsule yan? Tama ba? Make sense? Yes. Si benign ay lumalaki. Okay? Pero tandaan nyo, it's expansive and localized. Mabagal dahil alin? Okay, bakit guys? May capsule or walang capsule? Meron bang capsule na pumipigil dito? Yes. Kaya hindi ko makalat. Make sense? Now, if you actually use capsule, that's it. You don't need to memorize this. It will make sense. O bakit delikado si malignant? Mabilis ang pagkalat at pwede mag-invade ng other tissue and organs dahil may capsule na pumipigil or walang pumipigil na capsule? Walang pumipigil na capsule. Si benign, make no mistake, lumalaki din yan. It's expansive pero localized at mabagal. Alam niyo kung bakit? Meron bang capsule na pumipigil sa pagkalat kay benign? Yes. Make sense? Are simplifying here? Yes. Tama? And not to mention, ang laman nito, ito, kilala pa to. Okay, ito kilala pa to. If the doctor checks this under the microscope, kilala pa to. Ito, hindi na kilala. Okay? Bakit hindi kilala? Pwedeng bago. Okay? Nakukuha? Okay, Kobe. When you actually see differentiation, what type of biopsy are you pertaining here? Are you staging the cancer or grading the cancer? Staging or grading the cancer? Kobe? Grading or staging? Differentiation, ha? Excellent, Kaloy. Okay. What type of biopsy are you talking here when you talk about differentiation? Okay? Grading the cancer or staging the cancer? You are actually what? You're actually grading a cancer. Pag sinabing staging, okay, pag sinabing staging, you're talking about the tumors, you're talking about the number of nodes, and you're talking about possible organs and tissues for metastasis. TNM, naalala yon? Yes? Exactly. When you say grading, you're looking for the type of cells, normal, okay, abnormal, or cancer cells. So it's called grading. Nakukuha po ba? Yes? Okay. So are you done with this? Naintindihan na? Bakit delikado si malignant? Walang capsule, pwedeng kumalat. Anong nilalaman? Hindi na kilalang cells. Tama? Si benign delikado din kasi lumalaki. Pero as compared to malignant, etong benign, merong pumipigil. At ang nilalaman ng benign tumor is well differentiated. Kahit hindi siya magkapareho, alam ng doktor, ito RBC pa to, WBC pa. Yun nga lang, medyo may kalakihan ng konti. Pero alam ko alam kong klase, anong klaseng cell to. Okay? That's well differentiated. Now, okay, going back, anong tumors usually ang delikado? Ang gumagalaw o hindi gumagalaw? Ang nagagalaw o hindi gumagalaw? Ang hindi gumagalaw, lalo na painless. Okay? Lalo na yung painless. Mas delikado ang hindi gumagalaw at painless. Alam niyo kung bakit? Anong karaniwang laman ng isang cancer na tumor? Cells or fluid? It's cells. Okay, it's cells. That's why it's solid. That's why it's solitary. That's why it's quite enlarged. That's why lumalaki. Nakukuha? Oh, going back here. Dito sa letter B. Okay, dito sa letter B. A client reports a mobile. Pag sinabing mobile, nagalaw o hindi nagagalaw? Nagagalaw to. Okay? A golf ball size lesion under the skin. Okay? In the thigh that feels doughy. Okay? It's basically soft, rubbery, parang dough. Can we actually consider this as a lymphoma? Yes or no? Lymphomas are actually what? Lymphomas are actually, okay, benign tumors. Guys, going back in the question, we're talking here about cancer. So, bravo. Is this a possible sign na merong cancer yung pasyente? No. Okay. What about Charlie? Nagging cough. Is this a part of your caution as cautional? Nagging cough. Possible sign ng lung CA? Yes. Hoarseness. Possible sign of laryngeal cancer. Yes or no? Check. So letter C, pasok to. Tama? Okay. Next, what about letter B? A female client who weighed 150 and lost 15 without dieting. Can this actually fall under the category of sudden weight loss, unexplained weight loss? Pwede po ba? Yes or no? Yes. So pasok to. Okay. What about letter echo? Okay, what about mali yung Alabama, Boston, California, correct. Dallas is correct. Okay, ano ba yung state na letter A sa US? Texas, ayan, Texas. Yung Texas, tama mali. Okay, Texas, tama mali. Okay, sigurado? Male client? Okay, on the breast cancer ba? Yes, because alalahanin natin, ano yung tawag dito sa skin discoloration on the breast like that looks like an orange peel skin? It's known as your pudoranje. Okay? Orange peel skin or pudoranje. Is this one of the manifestations of your breast cancer? Yes. So tama yung California, Dallas, at Texas. Ayan. So the correct answers here are C, D, E. California, Dallas, and Texas. Ayan. Very good. Okay. All right? All right. Now, a little bit about breast cancer. Okay lang ba lecture natin? Okay? Okay lang lecture natin? Okay. Now, let's talk about your breast cancer kasi importante to. Now, okay. Breast cancer. Now, when you say breast cancer, no? Okay? Breast cancer, this is actually cancer, the abnormal proliferation or cancerous cells. The abnormal proliferation, ang pagdami. Okay? Abnormal proliferation. Okay? Of cancer cells. Okay? In the breast. Okay? Now, what are some risk factors of this breast cancer? Okay. Now, let's use the mnemonic LONGFO. Ayan. Old school na old school eh. Okay, halos lahat ng lecturer ginagamit to. LONGFO. Okay, now L stands for what? Okay? Late menopause. Okay? O stands for what? Obesity. Okay? N stands for what? Nulliparity. Okay? G stands for what? Genetics. F stands for what? Fat. Okay? All right. Fatty diet. And F stands also for 40 and above. Okay. 40 and above. O stands for what? O stands for oral contraceptives. Oral contraceptives. Okay, oral contraceptives. And E stands for early menarche. Tama yung sinabi ni Kobe, estrogen. Sir, saan yung estrogen dito? Actually, if we try to look at this, it all pinpoints to increase estrogen exposure. O, alamin natin ha. Alamin natin. Now, pag sinabing early menarche, less than 9 years old, tama ba? Pag sinabing menarche, dito ba lumalabas ang hormone estrogen? Nagsisimulang tumaas? Yes. Pag sinabing menopause, dito pa lang ba nawawala yung estrogen? Yes. Sabihin natin, early ang menarche, okay, at late yung menopause. Question, mahaba po ba ang lifetime exposure ng isang babae sa estrogen exposure? Yes or no? Yes. Kung mahaba, kung early ang menarche mo at late yung menopause mo, question, mahaba ba ang exposure, lifetime exposure ng isang babae, okay, pag early ang menopause, early ang menarche at saka late yung menopause? Yes. Does this all pinpoint to increase estrogen exposure? Yes. Nakukuha ng lahat. Okay? But kumukonting sumasagot sa akin, nakukuha ba ng lahat? I cannot actually comprehend if you guys are understanding what I'm lecturing here. Okay? What about the others? Are you following me? Okay? Alright? Guys, remember, pinakuha ko kayo ng test dito so as to save time. Okay? But it doesn't mean, it doesn't excuse us, no? It doesn't mean excuse yun para hindi natin i-review to. Okay? So, sabayan niyo ako dito ha. Okay. Nakukuha yun. During menarche, the first menstruation, doon pa lang ba mag-umpisa dumami itong estrogen? Yes. So kung early ang menarche at late yung menopause, mahaba yung exposure sa estrogen. Now, Sir, nulliparity. Nulliparity ka mo. Okay. When you say nulliparity, never been pregnant. Tama ba? Guys, tama ba? During pregnancy, okay, dito pa lang ba makakapahinga ang isang babae sa estrogen exposure? Yes, because estrogen will drop. It will be utilized. Tama ba? Estrogen will drop, progesterone will increase. Tama? To maintain the pregnancy. Estrogen will be utilized to maintain pregnancy. That's why, ang tanong dito, kung buntis ang babae, sa 9 months na yon, doon pa lang ba siya makapagpapahinga sa estrogen exposure? Yes. Imaginein mo, pag ang isang babae ay hindi na buntis, okay? Mataas ba yung chance niya ng estrogen exposure dito? Yes. And the more estrogen exposure, the more the breast cancer, di po ba? Yes. Are we clear? All right. Now, sir, bakit obesity? Fatty diet. Guys, what hormone is responsible for breast cancer? Estrogen. Here's the question. Is estrogen, okay, a fat-soluble hormone? Yes or no? Yes. So the more the fats, the more the estrogen. So question, sino ang karaniwan at risk sa breast cancer? Ang maliit yung boobs or malaking boobs? Okay? With all due respect, ladies, okay? Ang malaki ang boobs because the more the fatty adipose tissue, the more the fats, the more the estrogen exposure. Okay? Pero relax, hindi ko sinasabi na, sir, malaki ang boobs ko, ibig sabihin magka-breast cancer ako. Hindi po. Sabihin po natin, okay, between a woman with a big breast, pero walang genetic factor, walang familial tendency, okay, vegetarian, high fiber diet, walang history ng estrogen or pills, no? Okay? As opposed to a woman na maliit yung breast, maliit yung boobs, pero cancer runs in their family, okay? History of contraceptive. Sir, anong contraceptive? Ano bang nilalaman ng contraceptive? Estrogen. Tama ba? Yes. So, sino ang mas at risk sa breast cancer? Siyempre, ang maliit na boobs na exposed sa estrogen. Nakukuha po ba? Yes? Are we clear? Alright. Now, that's the reason why high-fat diet can actually increase or predispose a woman. Okay? Lalo na pag malaki ang breast, ano? Okay? For the possibility of breast cancer, actually, pag tininan mo, all of this pinpoint to estrogen exposure. Kung intindihin mo talaga, late menopause, nulliparity, obesity, okay, contraceptive, anong nilalaman nun? Okay? Estrogen. Tama ba? And increased estrogen exposure, is this one of the possible reasons for this reproductive cancer known as breast cancer, the most common cancer for females? Yes. Are we learning? Okay? Now, here's the question. Okay, here's the question. Right? Sir, how can we distinguish cancerous lump from that of breast cancer lump? Mamaya alamin natin. Okay? But first things first, alamin muna natin, abnormal proliferation of cancer cells in the breast. Now, what particular area of the breast ang karaniwang tatamaan? Okay. What particular site or area of the breast ang tinatamaan, guys? Okay. Your excellent Kobe, your upper outer quadrant. Okay, your upper outer quadrant. What are the signs and symptoms of your breast cancer? Okay? Avon. Ang ginagamit ni Wong na brief at deodorant, Avon. Ayan. At nilalagay na sa kanyang muka para maputi ang muka niya tapos yung leeg niya brown. Okay, Avon. Okay? A stands for what? Asymmetrical breast. Sir, di po ba, okay, common naman talaga, normal naman talaga na hindi pantay ang breast ng babae? Opo. But we're talking here about obvious. Okay? The obvious one. Obvious na hindi pantay. Okay? Ibig sabihin, okay, yung loy-loy. Okay? With all the respect. Ibig sabihin, if the breast becomes asymmetrical, yung breast na yon, meron po bang tumor yon na nagpapabigat? Yes or no? Yes. Now, V stands for what? Venous prominence. So dito, the veins are becoming visible. The veins are becoming visible. So dito, ang ugat-ugat sa breast ng babae nagiging visible. Anong indication nun? Meron bang tumor sa loob na lumalaki at umiipit sa blood vessels? Yes. O stands excellent. O stands for orange peel skin. Orange peel skin, also known as odorange. Kanina sa answer natin, sa lalaki, ano? At 1%, meron ding orange peel skin. Yes. And N stands for what? Nipple discharges or nipple retraction. And of course, tama, nipple dimpling as well, pwede. Okay? Alright. Please copy, guys. Okay. If you're done, key in the word done. Now, ganun ba kaimportante ang tinatawag na BSE dito? Yes. BSE is not confirmatory, but rather, this is used for what? This is used for early detection. Okay? Early detection only. Okay? Not confirmatory because what will confirm is biopsy. Okay? For screening purposes. Okay? The purpose is what? Okay? The purpose is baseline. Okay? Baseline and comparison. In other words, familiarity. Now, bakit kailangan maging familiar ng isang babae, okay, sa kanyang breast? Question. Buwan-buwan bang gagawin to? Buwan-buwan bang gagawin to? Yes or no? Yes. A woman has to become familiar with the breast because gagawin ito buwan-buwan. Tama ba? Yes. This is actually done monthly. Okay? Tama ba? But the question here is, dalawang klase kasi yan. Those who have regular menses and those who have irregular menses, pre and even post-menopause, kasi naiiba na yan. Tama? Okay. Pre or post-menopause, and post-menopause, wala na pong menstruation. Iba din, okay, yung sa pasyente na may tabso. Kasi pag tabso, wala nang menstruation. Now, is this done monthly? Yes. So since this is done monthly, does a woman need to become familiar with this one? Yes or no? Yes. Sa regular menstruation, when do you do this? Before, during, or after? Okay, after 7 days. In some books, 5, no? 7 days after menses. You do not actually do your BSE during menstruation. Aside from the fact that it's tender, your breasts are tender, talagang may makakapa ka dyan. Okay? Fibrocystic. Okay? Pero nawawala yun. Now, for those who are irregular ang menstruation, is this the monthly? Yes, monthly din. Pero saan to ginagawa? Okay? Say, kailan to ginagawa? Same date or same day? Excellent, Kobe. This is not done same date, no, but rather same day of the month. Are we clear? And do not forget, okay, do not forget that yung pattern natin, regardless of what pattern, no, circular, grid method, okay, what else, wedges, tandaan lang natin that our pattern for palpation here, should be what? Okay, inner to outer or outer to inner? It's outer, okay, outer to inner. Okay, outer to inner. Guys, make it quick. Ang bilis ng oras, my goodness. 8:36. Okay, tapusin na natin to kasi hanggang 9 lang ako. Magbabiyahe pa ako after nito. Okay, so done? Done? Okay, copy screenshots. Copy your screenshot. Okay, done. Now, okay. Health worker, breast exam. Ay, by the way, hindi ko nasabi. At what age pala yung baseline? At what age? 20 years old. Okay, is this done monthly? Yes. Is this done for life? Yes. But here's another question. Okay, kailan pinapacheck sa health worker? I say again, health worker ha. Okay? Health worker breast exam. Okay? Health worker breast exam. Okay, so sabihin po natin health worker, hindi yung kumpare mo, okay, hindi yung kapitbahay mo, but health worker. Okay, at what age ginagawa ito? Okay, this is actually done 20 to 39 years old. How often is this done? Every 3 years. Okay, but when you reach the age of 40 and above, this is done yearly. Ayan. Okay. Health worker breast exam. Okay, done? All right. Guys, balik muna tayo sa question ha. Okay. Okay na ito? All right. Okay. Done. Okay. So, let's go to number 2, guys. Let's go to number 2. A nurse is teaching, okay, about the warning signs of cancer. Okay? Which signs should the nurse provide to the group? Select all that applies, Sata. What is your answer here? Answer muna ha. Okay. Please key in your answer. Areas of alopecia. Kasama ba to? No. What about sores that do not heal? Pwede? Yes. Nagging cough or hoarseness? Yes. Okay. Indigestion difficulty swallowing? Yes. What about change in bladder and bowel habits? Yes. Okay. What about absence or decreased frequency of menses? No. Tama ba? So the answers here are, okay, Bravo, Charlie, Delta, Echo. Are we clear? Bravo, Charlie, Delta, Echo. Okay lang yan. Nare-review naman natin to, di ba? Okay. Yes. Okay, next number. Number 3. Okay. Now, guys, when giving chemotherapy as cancer treatment, the nurse recognizes the toxicity to rapidly growing normal cells also occurs. Which rapidly, I say again, na rapidly growing normal cells are also harmed in chemotherapy. The keyword here is rapidly dividing. Okay, so what are the answers here? Please key in the answer. Okay? Tama. Akala mo sa ano, no? Pero basically, hindi siya kasama sa caution as cautional. Okay. Bone marrow apektado. Is this rapidly dividing? Yes. Kung naalala kanina, myelosuppression. Tama ba? Yes. What about the retinal cells? Are they actually rapidly dividing? Kasama ba yung retinal cells? Okay? No. Kasi guys, kung kasama to, there's no such thing as blindness. Blindness can be reversed. Tama ba? Yes. Retinal cells once damaged, okay, it's damaged. Okay? What about hair follicles? That's why merong alopecia. Pwede? Yes? Okay. Now, what about nerve myelin cells? Pag na-damage ba yung nerves, okay, is it capable of regenerating? Yes or no? No. That's why there's no cure for paralysis. Okay, tama ba? Kasi once a nerve is damaged, it's damaged. Okay? What about your GIT? Your GI mucous membranes. Kasama ba? That's why merong nausea and vomiting. Tama? That's why merong alternating diarrhea and constipation. Yes. So the answers here are Alpha, Charlie, and Echo. Alpha, Charlie, and Echo. Are we clear? Yes. Next number. Number 4. Okay. Guys, kayo nga mag-answer nito. Okay? Kayo nga mag-answer nito. Okay, ilagay niyo mo yung answer to dito. But first things first, hanapin niyo kaya muna dito, okay, ang keywords or key phrase. Okay, there is a keyword there eh. What is the keyword in the question? The keyword in the question. There is a keyword there that will actually act as a clue. Pwede ba itong neutropenic? Yes. When I say neutropenic, am I talking about the WBC? Yes. If you are neutropenic, kanina leukopenic, neutropenic, are you prone to infection? Yes. So what are we looking here? Anemia, bleeding, or infection precautions? Infection precautions, mga dudes. So, hanapin na dito. Infection precautions. What is the answers here, guys? Make it quick. What are the answers here? Okay. Excellent. Okay, Camille? Okay. Now, do we allow fresh fruits, fresh vegetables? Okay, anything raw in the client's room? Hindi pwede because can this actually harbor microorganism? Yes. Anything fresh is a big no-no, mga dudes. This can harbor microorganisms. Removing fresh cut flowers. Yes, ito tama. You need to remove what is fresh. Tama ba? Yes. Meron palang follower si Daklis dito. No, 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 no. Ayan, no, 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 no. Okay, ayan. Okay. Konting-konti na lang. Pwede ka nang sumali sa kulto ni Daklis. Okay. Encouraging the client to eat any type of fresh vegetables. Okay. Anin Kobe? No, 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 no. Okay. Anything fresh is a big no-no. Next. Instructing the family members on proper technique for hand washing. Yes or no? Yes. Okay. D. Instructing family members to wear a mask. Enter in the patient's room. Yes. Okay, pwede, kailangan. Yung pasyente magmask din. Okay? Instructing family members to wear a mask and vice versa. The patient is immunosuppressed, immunocompromised. So hindi lang yung family members, pati yung pasyente rin. Tama ba? We instruct the family members to wear a mask because basically the family members might carry microorganisms. Okay? Tama po, Mia. Okay? Pwede magmask, dapat magmask. Hindi pwede kundi dapat magmask ang lahat. Because remember, we're talking here about infection precautions. Okay? Yung pasyente hindi contagious. Yung pasyente ang pwede mag-catch ng infection. So, kailangan protektahan ng pasyente. Okay? So, the answers here are Bravo, Delta, and Echo. Ito, infection precautions. Now, in this question, okay, what is the keyword in this question? What is the keyword in this question? Guys, what about the others? Okay, what about the others? Excellent. Okay, magparamdam kayo dyan. We're almost done with our class. Okay? It's thrombocytopenia. Pag sinabing thrombocytopenia, anemia, okay, infection or bleeding precautions. Excellent, Camila. It's bleeding precautions. Okay, it's bleeding precautions. So, alin dito ang mga bleeding precautions natin sa pasyente? Okay, bleeding precautions. Can we use a straight edge razor or electric razor? Dapat electric. Tama ba? Electric razor. Can you obtain a rectal temperature every 8 hours? Guys, alam kong hindi to invasive, pero can this actually puncture the rectum and cause bleeding? Yes. This is not revisable. Yung rectal, bawal yan. Okay, kasi pwede ma-puncture yung puwet. Hindi rin pwede. Check secretions, okay, for frank or occult blood because we're talking here about thrombocytopenia. Yes or no? Yes. Frank or occult. Occult means what? Hidden. Okay? Because blood could be hidden in the stools. Tama ba? In the urine. Tama? Okay. So, eto. Okay. Charlie is actually a part of your bleeding precautions. Give vitamin K for IM route. Okay, guys. Do we need to minimize this route, IM, kasi malalim to? Yes or no? Yes, tanggal to. Okay. Encourage fluid intake to avoid constipation. Yes, because if you're constipating, you're doing your Valsalva maneuver. Can this actually cause rupture? Yes or no? Yes. Okay. Provide oral sponges or soft toothbrush for oral care. Guys, this is bleeding precautions. So the answers here are Charlie, Echo, and Foxtrot. Sino ang naka-perfect nito? By the way, hindi ko nasabi. Sa NCLEX nyo, right minus wrong. Pero hindi ko na naano kasi naabunutin yung oras. Pero importante, tama ba kayo dito? Do you know how to answer, no? How to give yourself points when answering? Okay. Alam nyo na yun, di ba? Right minus wrong. Kung tatlo yung tama, okay, at apat yung na-answer mo, okay, sobra ng isa, ilang points yun? 3 points or 2 points? 2 points. Right minus wrong nga. Tama? Kung tatlo lang yung ang tamang answer, yung in-answer mo 5, okay, so ilan yung points mo doon? Okay, 3 minus 2, you only got 1 point. Pointing system na kasi ngayon. Unlike dati sa amin, kulang or sobra ng isa, mali. Okay? Now, so going back here, the answers are Charlie, Echo, and Foxtrot. Next number 6. Okay. Skin cancer prevention. Na-lecture natin kaninang skin cancer. with special focus on melanoma at a community health forum. Which statement should the nurse include? Select all that apply. What are the answers here? Okay. What are the answers here? Okay. Apply broad spectrum sunscreen before and during outdoor sports. Yes, because basically, all right, harmful rays from the sun, UV rays, can damage the DNA of the skin. Okay? All right. What about letter B? Apply sunscreen a few minutes before starting outdoor activities. Yes, and reapply this sunscreen. Tama ba? Yes. SPF 45 na ngayon, di ba? Yes, SPF 45 dahil sobrang init na. Okay? So Charlie is also correct. Serious sunburns can occur even on overcast days. Yes or no? Yes. Okay? Tanning beds. Okay, for more than or equal to 15 minutes for a base tan, less likely to burn. No. Regardless of what time, tanning beds can actually damage the DNA of your cells. So, okay, your skin cells. So, letter A. Tama or mali? Mali po ito. The answers here are only Alpha, Bravo, Charlie, and Delta. Okay? So, ilang points kayo? Lagay nyo nga ilang points. Right minus wrong. Ilang points kayo dyan? Okay, ilang points? Galing, 4 points. Pag may mali ha, okay, minus natin. Pero sir, paano pag kulang ng isa? Eh, walang minus po yun, right minus wrong nga. Tama ba? Okay? Alright. Next number. Number 7. Okay, Camille, okay lang yan? Okay. The nurse is participating in a staff presentation to review the risk factors for skin cancer. Which of the following risk factors should the nurse include? Select all that apply. Okay. Which are the factors that the nurse should include? Okay. Alpha, Bravo, Charlie, Delta, select all that apply. Okay. Family history, genetics, does this play a role? Yes. High number of moles. Yes. Nasabi pa natin kanina. Tama ba? Yes. Moles and freckles. Tama ba? Yes. What about history of severe adolescent acne, pimple? May kinalaman? Wala. Wala po. Immunosuppressant. Pwede? Pwede? Yes. Outdoor occupation, under the sun? Yes. So the answers here are all of the above except Charlie. Okay? Alpha, Bravo, Delta, Echo. Okay? Lagay niyo yung score niyo dyan. Lagay niyo yung score niyo. Okay, magaling. Ayos. Astig. Okay, good, good, good. Alright. Okay. Now, next number. Number 8. Okay. When caring for a client, by the way, you have a internal radiation implant. Now, when you say radiation therapy, okay, when you say radiation therapy, of course, this is a management for cancer. With the use of radiation, okay, this actually kills the tumor. How? By using the radiation to reduce or shrink, okay, or shrink the size, okay, of the tumor, okay, and therefore relieves obstruction. Radiation therapy works by killing the tumor, by shrinking the size, by shrinking the tumor, and thereby relieves obstruction. Ganun lang. Okay? You have two types of radiation therapy nurses. Okay? One is your internal and the other one is your external. One is your internal and the other one is external. Pag sinabing internal, the other name for this one is known as your brachy or brachytherapy. Pag sinabi namang external, the other term for this one is known as your teletherapy. Ayan. O, copy mo na. Okay, take a screenshot. Take a screenshot, please. If you're done, key in the word done. Now, okay na to ha. Take a screenshot, please. Take a screenshot. Or take a picture. Okay? Now, since ang topic natin dito is internal, ito pag-usapan natin. Okay lang ba? Under your internal radiation therapy. Okay na to, Sir Ronald? Mamiya? Okay na to? Yes? Okay. Under your internal radiation therapy, okay? Alright? Also, as brachytherapy, we have two subtypes. Okay? Yung merong solid na implant known as sealed. At yung other one known as your unsealed. Itong internal, meron itong direct contact sa pasyente. Okay? Direct contact sa pasyente. Okay? So pag sinabing sealed, you have a solid implant in the form of a bead, a needle, a pin na nilalagay doon kung saan kinuha yung tumor or kung nasan yung tumor na nandyan. Okay? It uses radiation to shrink the tumor. Pag sinabing unsealed, okay, nasa gamot naman ito. Okay? So pag sinabing gamot, diretso sa blood. Anong pinagkaiba ng sealed and unsealed? Ito, something solid, localized radiation. Since ang radiation ay nakalagay sa gamot at diretso ang gamot sa blood, ito naman systemic. Pero, regardless, localized or systemic, is there a direct contact, okay, ng radiation sa pasyente? Yes or no? Yes. Ito ang pag-usapan natin. Okay? Ito yung pag-usapan natin, itong sealed. Kasi sa sealed, guys, chances are, pwede bang ma-dislodge or mahulog itong implant? Yes. So as nurses, do you need to have equipments at bedside here? Yes. You need to have a long-handled forceps. Okay. You need to have a long-handled forceps and something to dispose, okay, your implant. Okay? Your what? Your lead container. Your lead container. This is where you dispose it. Okay? And as nurses, okay, so take a screenshot. Paki-screenshot muna. As nurses, caring for a patient, okay, with brachy or internal radiation therapy, you need to follow some principles. O, copy niyo muna or screenshot niyo muna. Okay? You need to follow some factors or principles. There are some principles you need to observe as radiation, no? Oncology nurses caring for a patient under radiation therapy. And these principles are known as your STD. Shielding, time, and distance. Naalala niyo pa to? Yes? Okay? Alright, paki-screenshot muna guys. Because I will erase this muna. Done? Okay. Sabi ko na nga sa inyo, di ba? Kailangan natin mag-post test. Kasi pag hindi, nagle-lecture pala ako ngayon. Hindi pa tayo nagpo-post test. Ayan. So sige lang. Okay? Ayan. Now, STD stands for what? Shielding. So do you need to protect yourself from oxygen exposure? Yes, by wearing your PPEs in the form of a lead shield or lead apron. Now, T stands for time. Do not forget, never remove your dosimeter film or dosimeter badge. Okay? This will actually time your exposure, no? Dosimeter badge, dosimeter film when entering the patient's room. Because this will actually be the one to keep track, okay, how long you have been exposed in the patient in the radiation. Now, how long should be in the patient, no? The whole shift, ilang minutes? 30 minutes. The whole shift. How many minutes per visit? 5 minutes per visit only. 5 minutes. A total of how many visits? We divide 30 with 5. That would give us 6 visits maximum all throughout the shift. Okay? Now, D stands for distance. Do you need to observe distance when caring for this patient? Okay? Not less than 3 and not farther than 6 feet. Okay? Should be your stance. Okay? Or distance away from the patient. Okay? So, STD. Shielding time and distance. Okay. Also, can we allow visitors? Pwede. Pero, kung pwede, wag na lang. Sino ang bawal na bisita dito? Bawal dito, okay, ang mga buntis. Okay? Bawal dito ang mga bata. Kids, okay. Younger than 16 years old. Bawal dito ang immunosuppressed. Bawal dito ang kakakuha ng vaccine. Guys, nako, my goodness. Bilisan natin ha. Okay, ayan. Done? Okay na? Magparamdam kayo guys. Tawa kayo sa akin. Okay, very good. Okay, all right. Now, so going back here, what are the answers here in number 8? I'll just give you the answers na lang ha. Okay, limiting the time with the client 1 hour per shift? No, it's only 30. Keeping pregnant women out of the client's room? Yes. Placing the client in a private room with a private bath? Yes. Wearing a lead shield when providing client care? Yes. Removing the dosimeter badge? Yes or no? Kakasabi lang po natin hindi pwede. Allowing individuals younger than 16 years old as long as they are 6 feet away. Bawal po, di ba? Sabi natin 16 years old and below, bawal. Okay? Right? Okay, so the answer is Bravo, Charlie, and Delta. Alam, mali yung D. Tama yung D ha. Okay, siguro ba si ano lang, baka human error. Pero yung correct answers dito is Bravo, Charlie, and Delta. Okay? Next. Okay, next. Number 9. Sige lang guys, human error. Okay, number 9. Okay. So, when caring for a patient with a CVL, no, central venous line, which of the following nursing action should be implemented in the plan of care for chemotherapy administration? Okay. Now, administer cytotoxic agent. Guys, no, kung naalala pa si extravasation, yes, you have to be very particular because if not, okay, can this actually lead to the leakage of vesicants, okay, into the surrounding tissue? Yes or no? Yes. So should you give your chemo drugs to keep the regimen on schedule even if the blood return is not present? No. Absence of blood return. Okay. Absence of blood return, okay, is a sign of extravasation. Okay? If the patient is unable to aspirate blood, reposition the patient, okay, and encourage the client to cough. Yes, tama to. Okay? Contact the healthcare provider about verifying the placement. Yes, tama din po ito. When in doubt, kasi possible extravasation. Inspect the insertion for swelling, erythema, drainage, pain, and blanching. Are these signs of possible extravasation? Yes or no? Yes, so check to. Verify the patency of the line with the presence of a blood return. Yes. So the answers here are Bravo, Charlie, Delta, and Echo. Okay? Bravo, Charlie, Delta, and Echo. Okay? Next number. Okay, number 10. The community health nurse is preparing to poster for an educational session for a group of women discussing the risk factors with breast cancer. Nasabi na po natin to kanina. Okay? Factors for breast cancer. So multiparity or nulliparity? It's nulliparity. So mali ito. Early menarche, pwede? Yes or no? Yes. What about early menopause or late menopause? It's supposed to be late menopause. What about family history of breast cancer? Yes. High dose of radiation exposure to the chest? Okay, yes. Previous cancer of the breast, utero, and ovaries. Why? What does these three have in common? What's the common denominator? The hormone estrogen. So, okay, is Foxtrot also correct? Yes. So the answers here, okay, are Bravo, Delta, Echo, and Foxtrot. Tama ba? Yes. Mali ang exam? Okay. Mali ang exam. Nako, kaya pala parang tinitingnan nila ako na parang halaman. Okay? Ano ba nakalagay dyan? Sige lang, sige lang. Dito lang muna kayo sa akin. Okay? Oh, sige lang. Next number. Eto, tama to? Tama to? 11. Okay, ito tama to? Okay to, hindi? Yes? Okay. Okay, sorry mga dudes. Okay? Baka may mali-mali lang. A client who is receiving chemotherapy for breast cancer develops myelosuppression. The keyword is myelosuppression. Nasabi to kanina, myelosuppression. Okay. So which instruction should the nurse include in teaching this patient? SATA, select all that apply. Okay. Avoid contact sports. Yes. Bleeding. Yes. Tama ba? Okay. Wash hands frequently. Infection precautions. Yes. Increase the intake of fresh fruits and vegetables. No. Avoid crowded areas, the shopping malls. Infection precautions. Yes. Treat a sore throat with over-the-counter drugs, or should you have it checked? No. Avoid people who receive a live attenuated, live or buhay na vaccines, no, or viruses. Yes. So the answers here are Alpha, Bravo, Delta, and Foxtrot. Okay. Next number. Okay, number 12. Okay. A nurse is caring for a patient diagnosed with breast cancer who just underwent an axillary lymph node dissection. Okay, what intervention should the nurse use to decrease lymph edema? Lymph edema, also known as arm edema. Okay, now, guys, if there is edema, is there swelling? Yes. So how do you address swelling? Do you lower, level, or elevate? Lower, level, or elevate? Okay? Basically, dapat, okay, elevate or keep the affected arm flat at the patient's side. Tama ba? Yes. Now, apply elastic bandage. Can this actually mobilize lymphatic fluid? Yes. Assess blood pressure only on the unaffected arm. Yes. Okay, dito muna. Arm edema or lymph edema, bottom line dito, okay? Activities should be avoided. Activities, including, okay, invasive activities. Alam niyo ba dito, bawal na yung blood extraction, bawal na yung BP cup taking, tourniquet bawal na rin. Okay? Saan dapat guys? On the unaffected arm. Kasi ang problema sa arm edema, lymph edema. Okay? Alright? Prolonged bleeding. So pag prolong ang bleeding, is the patient at risk for infection? Yes or no? Yes. Restrict the exercise in the affected arm for 1 week. Yes. So the answers here are Alpha, Bravo, Charlie, and Delta. Okay? So the answers here are Alpha, Bravo, Charlie, and Delta. Guys, pasensya na, sumobra tayo ng oras ha. Sige lang, okay lang. Hopefully, since some of you are still here. Okay? Yan. Now next, the disease progress. Eto ha, cancer staging. Okay, cancer staging. Stage 0 to 4. Okay? Incorrect order. So, if we're gonna put this in order, okay, how many stages of cancer are there? There's actually 5, including stage 0. Stage 0, 1, 2, 3, and 4. So 5 stages. Now, stage 0 is eto. Next, okay. All right, of course, stage 1. Okay, next. Okay, stage 2. Next, stage 3. And next, stage 4. So the correct sequence here, okay, is Charlie, Dallas, okay, Delta, Bravo, okay, Echo, and Alpha. Okay? Please take a picture na lang guys. Take a picture na lang nito. Okay? Please take a picture na lang para meron kayong ma-review. SSD. Yan, SSD. Okay? Next. Okay. Breast cancer, lumpectomy with sentinel lymph node biopsy that is positive for cancer. Okay. So dito, determine the risk for cancer, okay, of the breast or spread. What results support a more favorable prognosis? More favorable, okay? So obviously, if it's well differentiated, is it malignant or benign? It's actually, okay, benign. Okay. Estrogen receptor positive tumor is also correct. Okay. Involvement of 2 or 4 axillary lymph nodes is actually wrong. Why? It means what? Already spread or metastasis. HER indicates, okay, the growth of tissue. So this is wrong. Okay, and this is wrong. The correct answers here are only alpha and bravo. Take a picture. So you have something to study. Take a picture. And I'm going to leave my my account here. You can message me, okay, for any questions. Sige lang. Okay lang. Pero guys, kahit pa paano sa 4 na oras natin, guys, may nakuha ba kayo? Kahit konti. Kahit konti lang. Okay? And mga dudes, huwag niyo isipin mahirap yung SATA, ha? Okay? Walang mahirap. Okay? You have no choice but to go up. Okay? Please don't put it in your mind na mahirap. Okay? Next number. Ito na lang gagawin ko. I'm gonna give you the answer and usap lang tayo. Then message me if you have any questions here. Okay. Community health nurse provides education program about risk factors for prostate cancer. Which of the following statements by the program attendees indicates the teaching has been effective, so we're looking for something positive with regards to prostate cancer. Okay, so letter A, African Americans have a higher risk for prostate cancer. Na tama ba? Tama ba? Nasabi to kanina? Yes. Eating large amounts of red meat may increase your possibility for prostate cancer. Yes, nasabi to kanina. I should avoid taking NSAIDs to prevent prostate cancer. No. Okay, this is actually wrong. NSAIDs, actually, studies show that NSAIDs may lower down, okay, may lower down the risk of prostate cancer. Okay? Now, what about Dallas? The father had prostate cancer, so the son has an increased risk. Tama ba? Yes. Okay. 40 and above prostate cancer. Tumataas ba yung tsansa habang tumatanda? Yes. So the answers here are Alpha, Bravo, Dallas, and Echo. Okay? Please screenshot, guys. Okay, screenshot. Okay, next. Okay, prostatism is actually a symptom. And the most, okay, and is most common with BPH. This actually leads, okay, this actually leads to obstruction of the urethra. Okay, of the urethra. So, daanan ng ihi. The neck of the urinary bladder. So, basically, this is due to what? This is due to the enlarging or lumalaking prostate. So, since lumalaki ang prostate dito, guys, okay, can this actually cause the inability to stop urinating? Yes or no? Yes, kasi lumalaki. Okay? Post-void dribbling of urine, okay? Or urinary dribbling kasi lumalaking prostate? Yes. Increased episodes of nocturia, yes or no? Yes. Okay. Unusual force. Is there force because there's obstruction? Wala po. Nawawala yung force dito. Okay. Hesitancy on urinating. Okay. Initiating the start of the urinary stream. Yes. Please take a picture, guys. Okay. Alpha, Bravo, Charlie, Echo. Sana in-early ko na lang kanina. Sige lang, sige lang. At least you have something to study. Okay? Huwag na kayong malungkot, ha. Okay? Sige lang, hindi na kakakailangin pagkatapos nito kasi magiging USRNs na kayo hopefully. Now, nausea and vomiting. Eto ha, pag may mali pa dito ha. Okay. When should a nurse administer antiemetics? Before, during, or after? Ayan. Okay. Biglang nagkabuhay si Mami. Langiya, sir. Wala na bang mas mahirap dito? Hindi namin level to. Yung mahirap, sir. Bigyan mo kami ng mahirap. Okay. So the answer here is letter A. Okay, hindi to sa question. Okay, sabi ni Ma'am Mia. Insulto to ah. Wala namang mas mahirap dito. Insulto to. Hindi namin level to. Okay, hindi. Biro lang. Biro lang. The answer here is letter A. Next number. Okay. Hodgkin's. Okay, these are signs and symptoms, no, of Hodgkin's disease. Which of the following statements, okay, by the client should cause the nurse to suspect potential Hodgkin's lymphoma? Okay, so what are the answers here? Okay. Regular fever but do not have chills, no, or feels bad. Okay, so the answer letter A is actually correct. Okay, lump in the underarm for several weeks. Pero guys, no, aside from the underarm, okay, right, also look for cervical. The most common, okay, lymph nodes affected here are the cervical lymph nodes. Pag wala si cervical, guys, look for axillary. Okay? All right? All right, so letter B is also correct. Weight loss. Okay, weight loss. Unexplained weight loss. Is this a sign of your Hodgkin's disease? Yes. Is this a sign of cancer itself? Yes. Okay. Pruritus. Is this actually a late sign? Pruritus. Okay. Is pruritus a late sign, okay, of your Hodgkin's? Yes, correct. Okay. What about echo? Night sweats. Is this also a sign of your Hodgkin's? Yes. So the correct answers here are all of the above. Ayan. All of the above. Guys, nasobra na ako ng oras. Pasensya na ha. Pakihingi na lang ako ng 2 minutes sa inyo. Picture muna. Okay? So dito na lang muna yung mukha ko kasi nahiya ako sa inyo ha. Ayan, at least mata lang. Okay. Alright? Okay. So, para at least pwede naman pagkamalang si Doc Liz or si Wong. Ayan. So ito na lang muna yung mukha ko pa nag-lecture ha. Okay, mata lang muna. Okay. Okay, the nurse is reviewing the record of a client admitted with the diagnosis of Hodgkin's disease. Which assessment findings is associated with this one? Do you have fever? Yes. Do you have weight loss? Yes. Night sweats. Visual changes is a no-no. Enlarged painless lymph node. What lymph node again? Cervical lymph nodes. Pag walang cervical or neck lymph nodes, look for axillary lymph nodes. Ayan. So the answers here, okay, are all of the above. Okay? All of the above except letter delta. Ayan. Okay. So last question. Gusto niyo muna mag-break? Okay? Para mag-relax? Okay? Makapagpahinga? Mga 1 oras? Pagbibigyan mo kayo. Okay. Pag-break kayo, tas layas na ako dito. Okay? Ayan. Biro lang. Okay. Multiple myeloma is actually a cancer. Cancer where? Okay. Cancer in the bone. Okay? I'm sorry. Cancer in the blood as well. What blood component? Plasma. Okay? Now, since multiple myeloma is cancer of the blood, what makes your blood? Bone marrow. Where can you find the bone marrow? In the bone. So therefore, when you say multiple myeloma, is this cancer of the blood and the bone? Yes or no? Yes. Okay? So, since there is cancer in the blood, increasing the osteoclastic activating factor monoclonal proteins, lalakas ang bones o hihina ang bones? Lalakas or hihina? Hihina. Pag mahina ang bones mo, are you prone to fractures? Yes. Anong klaseng fracture? The unique fracture in the absence of injury? Pathological fracture. Yes? Okay. Next. What is the cancer marker? The cancer or the tumor marker of your multiple myeloma, which can be found in the urine, your so-called Benz-Jones protein. Are we clear? Yes. Okay. What about letter C? Hemoglobin, is this normal? Yes. Now, what about the calcium levels? Okay? Is it hypercalcemia or dapat hypocalcemia? It's supposed to be what? It's supposed to be hyper, hindi hypo ha. Hypercalcemia. Guys, dito muna. Nasisira yung bone. Pag nasira yung bone, osteoclast, diba? Pag sinabing osteoclast, anong klaseng calcium movement yun? Bone to blood or blood to bone? It's bone to blood. So, pag nawawala yung calcium sa bone, didiretso ng blood, what will happen? Hyper or hypocalcemia? Hypercalcemia, and delta or Dallas is not hypercalcemia. It's normal. Tama ba? Yes. But if the question asks you, what becomes of the calcium level is in your multiple myeloma? Sagot, hyper-hypo. Hyper-hypo. Hypercalcemia, mga dudes ha. Hypercalcemia. May fracture, di ba? Okay? Nasisira yung bones. Okay? Osteoclast is active. When you say osteoclast, ano yung movement ng calcium? Bone to blood or blood to bone? Bone to blood yung calcium. Hypercalcemia, baba yung calcium sa bones, prone to fracture. Anong fracture? Pathological fracture. O, eto pa. Okay. Letter E is correct ha. Okay? Masisira yung kidneys dito. Pero eto pa. Aside from pathological fractures, can you also expect osteoporosis here? A body-wide degeneration of bones in your multiple myeloma? Yes. That's the reason why, aside from chemotherapy, can you expect medications known as your biphosphonates? Biphosphonates to be given here. Okay, biphosphonates to be given here for the treatment of multiple myeloma? Yes. Sumobra ako ng 19 minutes. Pasensya na mga USRNs. Okay? Mukha na tayong gulay pero importante meron tayong nakuha kahit konti sa lecture. So good luck and God bless sa inyo. Okay? And hopefully kahit papaano nakatulong sana sa inyo. Okay? So picture sa questions para meron mapag-aralan. Okay? And dito lang. Message lang ako dito if you have any questions. Okay? May God bless each and every one of you. God bless. Okay? Huwag niyong kakalimutan, if we made it, if your colleagues made it, no one is stopping you, okay, to become USRNs. That is your goal. You have no choice but to go up. You have no choice but to pass and become USRNs. Okay, kami, 10 na mga kasama ko dito sa Top Rank International na mga lectures na Sir Jesse nyo, the staff, okay, wala kaming hangad, kundi, okay, matulungan kayo, and we are all excited to greet each and every one of you. Congratulations. Ngayon pa lang, congratulations in advance. Okay, my soon-to-be fellow colleagues, USRNs. God bless. Ingat. God bless.
Sir, thank you so much po, sir.
Thank
Good
you,
night
thank you,
po.
Thank you, sir.
Thank
Thank you
you.
so much, sir. Thank you.
Thank you po, sir.
Thank you, thank you.
Thank you.